Fine.
Okay. I shared you a flyer of the launch of the 100 days.
Okay. Are we live on YouTube as well already?
No, as of now.
Very good afternoon. Good afternoon, Dr. Prakash.
Good afternoon, sir.
हाँ नमस्कार जी, नमस्कार नागन जी।
प्रकाश जी कैसे हैं? How are you?
ठीक है मैडम, बहुत बढ़िया मैडम। गुड आफ्टरनून टू
Good
ऑल।
afternoon.
हाँ नमस्कार उदय सर, नमस्कार जी, नमस्कार उदय सर।
कोतनकर सर कैसे हैं सर? Good afternoon सर।
नमस्कार।
नमस्कार सर।
नमस्कार।
उदय सर नमस्कार from Hyderabad.
नमस्कार, कैसे हो आप? हैदराबाद पेरे एंटी हैदराबाद।
Visit again.
नागन जी,
थैंक यू।
मेरे को इनिशिएट करना होगा। डॉक्टर प्रकाश आ रहा हूँ मैं, सेक्रेटरी जनरल, तो मेरे को होस्ट बनाना पड़ेगा सर। तो कैसे करना पड़ेगा?
Dr. Samir will have to make you the co-host.
Okay. तभी मैं
मैडम
ideally we can pause the live stream and just begin again when we are ready.
Sri Krishna sir, how are you?
I'm good, sir.
Thank you.
Hi, good afternoon.
समीर ज्वाइन हो गया क्या? हिमा बिंदु
Good
आ गई।
afternoon, Dr. Ali.
Hi, Salima. How are you? Hi, sir. Good afternoon.
Good afternoon. All good. Dr. Shri Krishna is also here. Dr. Himamintu, of course, is here. Dr. Ali. And we have many other senior members from the IAP-AHA, team. Bhushan ji, can you switch off your audio and video, please?
मैम हिंदी में बोलो।
अच्छा, आपका आवाज आप अपना वीडियो और ऑडियो थोड़ा ऑफ कर देंगे अभी के लिए। हम अब तक स्टार्ट नहीं किए हैं भूषण जी।
डॉक्टर जोया is also joined.
Oh, great.
Thanks, ma'am. Thanks for joining.
Hello.
Yeah, thank you. I'm right here.
I think let the host mute all.
डॉक्टर सैयद अली, सलीमा, रमजान मुबारक आपको।
Thank you, sir.
Thank you.
Hello, ma'am.
Yeah. I am from Nagpur speaking.
Hello, ma'am.
Hi, Salima.
Hello, Nirmala ma'am. How are you?
Good.
We were waiting for you.
No. I joined long back, but with another.
Hello.
Thank you, ma'am.
Ma'am,
So, ma'am, we have Dr. Ali, and I don't think you've met Dr. Hima Bindu in person or online. She's now the IAP-AHA, president. So the IAP-AHA has helped us in developing the modules, ma'am. Thank you for approving them, and thank you for asking Zoya ma'am to launch them, ma'am. Thank you.
Yeah, ma'am, we're very happy, ma'am. Because this is a very good program, and the modules I have watched the modules, they are so good, and definitely they'll reach to adolescents.
Thank you, ma'am. Thank you.
Ma'am, we request you to please rename. That is why we couldn't identify you. We will make you co-host then, so that you can unmute yourself and speak.
Yeah.
32 people have joined.
Salima?
Yes, Dr. Sushma. Now we can at least see your thumbnail.
I have joined to
Oh,
my
great.
mobile phone.
Great. Dr. Sushma, Dr. Nirmala was just here. She's the RKSK Nodal Officer from Government of AP. Nirmala ma'am, Dr. Sushma was a very core part of the module, technical committee who helped us develop the module. So,
Hello,
Very
ma'am.
good afternoon, Nirmala ji. How are you?
I'm good, ma'am. I'm good. How are you, ma'am?
So happy to see you. and welcome to the
Nice
team.
meeting you, ma'am. Nice meeting you. Thank
Same
you.
here. Same here.
Also, welcome Dr. Suraj. Thank you for putting in the efforts for developing the module. I think it's turned out well. Thank you.
Thank you, Dr. Salima ma'am. It was
Surajji, it has turned out to be really nice one.
Thank you so much, ma'am. So happy to hear that. Especially, it's good if we could give it the right justice to the hard work that was done by. Thank you so much.
Ma'am, I think Zoya ma'am has joined.
Good afternoon. Dr. Arya, sir?
Yeah, madam.
Dr. Arya, sir?
Yes, madam. Yes, madam.
Hello.
Hello.
Prashant.
Hello.
So we can hear you. Who's the host? Dr. Samir, are you there?
Welcome, Zoya ma'am. Dr. Shri Krishna, Dr. Zoya has joined.
Yeah.
Thank you, Dr. Zoya, for joining.
Yeah, madam. Yes, madam.
Thank you, ma'am.
Yeah, I'm right here.
Right, ma'am. Ma'am, Nirmala ma'am is also here. And
Good afternoon. Dr. Arya, sir,
Good afternoon, ma'am.
members को call करिए, sir. EB members.
अच्छा, yeah, madam.
Sir, पहले से
मैं बोला ना मैडम, मैंने इन्फॉर्म किया है उनको सबको, फिर दोबारा से मैं फोन कर देता हूँ अभी.
हाँ, please call up them.
Yeah, madam. Yes, madam.
Because Dr. Vasant is joining now anytime. I spoke to him. We were nice to see Dr. Ali. Good afternoon, Dr. Ali.
Hi, madam. Good afternoon. Nice to see
Greetings
you.
on behalf of AHA. Nice to see Dr. Zoya has also joined. So thank you, Zoya ji. Good afternoon, Dr. Zoya.
Yeah, hi, Dr.
Hi, how are you?
See you virtually. Yeah, long time.
I know, long-term association with you for decades.
Yes.
Yeah. So nice to see you from the ministry. Dr. MKC Nair, sir, welcome you, sir. Dr. Sushma Desai, we all welcome you, sir.
Namaste.
Namaste, sir. And I think we have from the AP government, Dr. Nirmala. Welcome, Dr. Suraj, also from UNICEF.
And then you stop that server thing. Go to anything LLM. And you can use anything LLM just like normal, okay?
Good afternoon, Dr. Rajiv. I think
I'm sorry.
Rajiv is here.
Yeah, sorry, I'm sorry. Yeah. Hello. Hi.
Hi, nice to see you after Nagpur.
Yeah.
So you're part of our family.
Himabindu, good afternoon.
Good afternoon, sir. Thank you for joining, sir. Dr. MKC Nair, sir, is one of our leading senior pediatricians who has actually founded the Adolescent Health Academy, where we are all working now. And his presence means a lot for us. Dr. Uday Bodhankar, sir, also past president, both are past presidents of IAP, senior members from IAP. And Uday Bodhankar, sir, works more on the social front. His presence is very encouraging for us. Dr. Sri Krishna, if you can give a little time for the...
Yeah, see, we need to do a couple of settings before we begin.
Yeah, no, what I'm saying is...
Only the co-host will be able to speak. Whoever is the host will have to mute everyone. Everyone will include even Dr. Vasant in case he is not yet joined. In case he joins, then we'll make him the co-host. Dr. Samir, are you there, sir?
Dr. Neelam has joined. Welcome, Dr. Neelam.
I've joined from somebody's phone since I'm in Burma. So pardon my, whatever name is coming, I'm not sure. So
that's fine.
No name is there. Somebody recognizes you.
Yeah. Dr. Neelam, I'm just renaming your ID here.
Yeah. Dr. Prashant is also here, Vice President. IAP is also joined. They're just waiting for Dr. Vasant.
क्या बोला? Last में?
iPhone
मतलब मान लो कि अगर हम किसी को
12:30 nali mabe no. Sunday.
Neela madam, good afternoon.
Krishna, when our main program start, we will mute everyone. That's not a problem. That we will manage.
Sure.
Thank you, Prashant. How are you?
Fine, madam. Fine. I think the organizers are very strict to follow the rules, regulations.
Yeah, Dr. Sri Krishna.
कृष्णा इतना सीरियस होके क्यों बैठा है?
करना पड़ता है सर, करने के लिए बोला है। मैं ऐसा हूँ क्या आपको पता है?
How are you?
सर ज्वाइन कर लो।
Okay. Sir Sri Krishna, Dr. Vasant Kalatkar has joined, our president. So any more dignitaries who are likely to join, we can start the meeting. It is we have crossed 3 o'clock. So can we start the meeting? Dr. Arya sir, please start the meeting, sir.
Yes, ma'am. Yes, sir. Very good. Very good afternoon. May I audible?
Yes, yes.
Very good afternoon. After a grand celebration of Festival Holi Pan India, I welcome all the esteemed guests from CIAP present in this webinar. Our President, Dr. Vasant Kalatkar sir, Dr. Hima Bindu madam, Dr. Salima from UNICEF, Dr. Shushma Desai, Dr. Anurag Pandey, and all the CA Center AHA office bearer and EB members. Now I invite Hima Bindu madam for
Sri Krishna
remark of this
program. I request Dr. Sri Krishna, who's to conduct the meeting.
Namaskaram everyone, and a warm welcome in the hot month of March as we enter the next series of IAP-AHA Empower Yuva program series. Thank you all for joining in, and it's my pleasure to welcome distinguished guests today for a very special webinar. And to take this forward, I now invite the champion of adolescent health in the country of India, Dr. Himabindu Singh ma'am, who's the chairperson of the IAP-AHA at the national level. And I request her to please take things forward. Over to you, Dr. Himabindu ma'am.
Thank you, Sri Krishna and Dr. Arya. It's my pleasure to chair this session or invite all the dignitaries on dais. Very good afternoon to all of you, especially a warm welcome to our Central IAP leadership, Dr. Vasant Kalatkar, who is our president this year, 2025, and Dr. Neelam Mohan, the next year president, the president-elect for us. Thank you, Neelam, for joining from so far. And we all welcome Dr. Prashant and Dr. Preeti Galgali, who are vice presidents of Central IAP. And we also like to welcome our dignitaries, senior pediatricians, Dr. Uday Bodhankar sir and Dr. M.K.C. Nair sir, who have been the past presidents of this prestigious Academy of Pediatrics. And we also would like to welcome from the ministry, Dr. Zoya Ali, madam, whom I know her very closely. I used to go so frequently to the ministry at Delhi, and she's been associated with Adolescent since long time. She's very, very supportive to this agenda. And Dr. Zoya, here in AHA, we are committed to bring youth into the forefront. So we are actually involving the youth in all our deliberations. So we love to see collaboration with you too, along with, of course, UNICEF. And a special welcome to Dr. Ali, Syed Hubey Ali, who's been very, very supportive. Just 1 or 2 meetings, and then he has come across with a good plan for us. And really so exciting to see, to work with him. And along with Salima, who's from our own Hyderabad, and we used to sit in UNICEF office planning what to do for this year. And so nice to see that this has come up to this level. I also would like to welcome, we have all the other dignitaries here, the special youth forum. I think this is the youth forum we have created for them. A warm welcome to all our young people here, and our the program in charge of adolescent health from the ministry at AP, Dr. Nirmala, A special welcome to you, Dr. Nirmala Glory. We would love to see this collaboration with every state, and Dr. Sri Salam and Dr. Samir Shah, and of course our Dr. Shibu, who's in charge for this program, will take things ahead. So a few brief remarks from my side, just for people who may not know what is this Youth Wellness Day. So we at the IAP and AHA have thought about bringing the youth health into the forefront, and why not have a special day for the young people like we have for all the pregnant women. The ministry also is now thought 9th day of every month as a something for the antenatal, very special day where people mobilize, and there's a lot of focus on antenatal care. Similarly, we thought young people who are nearly 40%, if you count everybody from children to young people, they constitute such a huge population, chunk of our population. They have different problems, and we have to do capacity building of our stakeholders to see that they get due attention. So we have to invest on adolescent health. We have guidelines since long time. So the Adolescent Health Academy, which was formulated way back in 2000 by our stalwarts like Dr. MKC Nair, who's very much here with us today. They have started this academy of pediatricians. This is under the umbrella of Indian Academy of Pediatrics. So we are focusing on adolescent health for the last 25 years. So this is a very special year, the Silver Jubilee year. And we announced that we will focus on adolescents and empower them. So we said Empower Yuva is our main program theme, the theme for the whole year. So we have a conference in Ahmedabad where Dr. Sushma Desai, who's my next chairperson who will take over from me, she is going to organize this conference in Ahmedabad, and we would love to see the whole year focusing on Empower Yuva programs. So monthly, every month on 18th, we would like to announce this as a Youth Wellness Day and bring everybody on to collaborate and work throughout the country on youth wellness on certain criteria. So 2 messages every month, and this month we have taken NCDs, diabetes, fitness and wellness as our main theme. And the youth we have created a youth forum under the AHA. The young people themselves prepare the flyer, they prepare the program, they are designing the PPTs, and they are on the stage actually as presentators. Their voices are being heard, their unique stories are being heard, and we would like to care for them accordingly. So this is our main agenda. And with this, we would like to see collaboration with UNICEF and also the ministry. I request the ministry to kindly consider 18th of every month as Youth Wellness Day, and we can scale it up at the national level along with all the partners. Now I request our IAP President, Dr. Vasant Kalatkar, to please bless us and say a few words regarding this special initiative of Wave 18 and the Youth Wellness Day. Over to you, Dr. Vasantji.
Yeah, good afternoon all. It's really, it's a time that 3 p.m. is there. Dr. Neelam, our national president-elect is there. Our secretary, our treasurer, national IP, and especially Dr. Himabundu, who is leading for this esteemed chapter, that is Adolescent India, with Secretary Arya sir, all the members. You see, this chapter is really having a great legacy and doing the best of the best of the. And this year again, this new thing Dr. Hima is doing for youth awareness. I welcome today's invited guest, Dr. Joya Ali Rizvi. He's the Deputy Commissioner of Adolescent Health and Ministry and Health and Family Welfare. Dr. Nirmala Glory, RKSK Nodal Officer, Government of Andhra Pradesh, and Dr. Syed, who is very close to me from UNICEF. And all those invitees, I welcome you on behalf of a Central IAP as a President. Really, it's a great moment we are doing. We all know that you might have seen our movie that Disha and obesity, especially related to youngs and adolescents. So basic theme for that, the drug abuse. And to start with the picture, I am telling everybody that हम लोगों को बहुत बड़ी गर्व की बात है कि हमारा देश 30% 30 to 40% युवा को रिप्रेजेंट करता है, और अपने मोदी जी जो प्रधानमंत्री मोदी है, he is doing lot of work for empowerment of युवा. But still there are few problems like this drug abuse, bullying, and all these. There are so many issues are there which we are going to discuss in youth. But I think when our PM is doing so much for these, a small part, small thing we can do, and that's youth empowerment. And we are the best person who can empower you are, and that's the thing taken up by Dr. Hima, the chairperson for this year, and her team. I really want to congratulate. See, the zest, this enthusiasm and perseverance of Dr. Hima Bindu and all IP adolescent members. I really salute to you all for your perseverance, everything. And see, Hima Bindu never talk about her only, never. She always talk about adolescents, adolescents, adolescents. That's really great, and it should be like that. I also learned that I should talk only about central IP, nothing else. That's why nowadays I am talking about central IP. There's no persons. That's really, thank you, Hima, for teaching me that always talk on our chapter and everything. Thank you. And this really credit also goes to Dr. Bansal, Dr. Sushma. These all Bansal sir, then our Dr. Bansal from Kota. These all people are really doing hard work. It's really great. And this year we had a most successful TOT. That why? And when the concept came from Dr. Hema Bindu that we want to go for this, I say yes, we will go ahead and we will have a TOT. And we are going forward in next few days for having a dissemination of that TOT. That we are having now strong pillar of 60 our members, those who are well trained in that workshop, and we are going to disseminate this district-wide very soon. So today's really it's a great program, and that to be with the UNICEF, Government of India, we are doing really. And last Sunday, we had a meeting with UNICEF people. Dr.
Yes.
was there. They also agreed that if you are doing for a UA, that's especially on mental health. We are going to help you, and our module is getting ready. We will unite with UNICEF and we will launch that module in a big way. This is a really start doing by Adolescent chapter 2025 year. I wish all the best. Let us go together, and though parent branch is IAP, this is the Bachu or kid of IAP definitely doing the best. I wish all the best to all the office bearer of IAP, and thank you all the today's speaker, invited guests for coming for this webinar. Thank you.
Thank you so much, Vasant Bhai. Your presence itself means a lot for us, that we are under the umbrella of Central IP and we are taken care of, and we will definitely work together. Your initiatives like the cinema and all that is so much impressive. We are with you, and we will take this forward, this lead for the youth. Thank you so much. Now I request Dr. Neelam ji to kindly give her message for this Youth Wellness Day and the collaboration what we are having with Ministry and the UNICEF. Ministry, we are looking forward. Thank you, Neelam.
Thank you so much, Hima, and the Adolescent chapter for this stupendous job. It is indeed an honor to be here on this platform with experts from all forums. So nice to see that the children of CIP have grown so big. It's amazing to know that it's already silver jubilee of a chapter of our IAP. So I would congratulate the founders, MKC Nair, and followed by Bansalji, Geeta Patel, Sushma Desai, who are going to Shamek, and all those who are going to be taking the reins of AHA, and the phenomenal work they are doing truly needs to be applaudable. And it's indeed a delight to see, Sayed Ali ji, Zoya, and all join, because I think there is one thing common between whether it is the Ministry of Family Welfare, UNICEF, is that we have a common mission. And this mission is to ensure that every child gets the best start in life and access to quality health care. And when we talk about the every child, it goes without saying the adolescent need to be under the umbrella of the pediatricians, because who better than them can understand the emotional and the various needs that are required in this group, which is neither an adult and neither young children. It's also a pleasure to see the vice presidents, Prashant, Preeti, on the forum that have joined, Udayji, who's also been with that. So I would just say that all of us have envisaged that NCD is becoming a silent epidemic, and conditions like which we would have never been teaching our youngsters or have read ourselves much, the childhood obesity, diabetes, mental health disorders, hypertension, all this, and of course, respiratory illnesses due to pollution, allergies, all this are getting so much importance. And from the adolescent chapter, when they talk about the wellness, I think this is one group where they clearly want to shout loud and say, when they talk about wellness, it is not just the physical, but also the mental. Eventually, I think they should encompass the spiritual and the social wellness in this group, because that will make it completely holistic. And if you want to address the issues in adults in our country, then obviously it's time for us to shake the stakeholders and to remind them that isn't it time to look into the burden of children, and that's how you'll be able to address them better. So, with that few words, I would congratulate the whole team, Central IP, under the leadership of Dr. Vasant Kalatkar, the Ministry of the Andhra, as well as UNICEF team. It was a delight to meet the entire team, including the regional office bearers recently. And the work with which they are working is all of us, I think, and Central IP is working shoulder to shoulder with the AHA to ensure that we strengthen the public awareness and community program, because besides working on educational strengthening for our colleagues, it's important, and besides into research data, it's important for us to work on community through such endeavors. Thank you for having me over, and best wishes to the team who's going to enlighten us. Sunita, I can see, and the other
Thank you.
members in the team. Congratulate you all for this stupendous work, and best wishes for the coming year too, under
Thank you,
the
Neelam.
leadership of the teams.
Thank you so much, Neelam. Like we have Dr. Zoya and Dr. Ali now. Can we have, sir, one line message, sir, Dr. MKC Nair, sir, before we go to them, sir, one line. Dr. MKC Nair, sir. Dr. Uday Bodhankar, sir, one line from you, sir, because we are one blessing, one line, sir, please.
Thank you all. Thank you, Hema Bindu. Thank you, Dr. Vasant Katkar, Dr. President-elect, Dr. Neelam Mohan, and all MKC Nair, who is a mentor. See, the AHA, the Silver Jubilee, my greetings to all you, because the AHA was formed with the people like MKC Nair, Swati Bhave, Tuteja, then all other people who follow, Geeta Patil, and then Hema Bindu. So my salute. This youth program which Hema Bindu you brought is a really wonderful idea, because NCD, we had UNICEF meeting in Nagpur, you attended. The NCD has been taken as a challenge by UNICEF along with IAP and along with Minister of Health, Government India. So we were with this youth leader who has joined here from all India. I think we must address this issue right from
Yes, sir. This
prevention.
meeting is there for that purpose, sir.
Yeah, for prevention and treatment. So thank you for calling me. Thank you. All the best.
Sir. Thank you, sir. We'll hear from other dignitaries. Dr. Sri Krishna, over to you. And we can have the Vice President message maybe in between, and Dr. MKC Nair in between later. Request Sri Krishna to please invite our esteemed guests, Dr. Ali and Dr. Jaya.
Thank you. Thank you, Dr. Hema Bindu, and thank you all the support from the Central IAP. It's now our pleasure to welcome Dr. Syed Hube Ali, UNICEF health specialist, to please give his message on the inaugural event of the webinar today. Over to you, Dr. Ali.
Thank you, and welcome to all respected Dr. Zoya Ali Madam, Dr. Vasant Khalatkar Sir, Dr. Hima Bindu Madam, and all the dignitaries and the youth colleagues who have joined from across the country. Special thanks to Pooja Mishra, who is the National Coordination for the Youth Lead Voices. So, Hima Bindu Madam, before I start, I have a request for you. Next time we have a link to have more capacity, the bandwidth, because I am having WhatsApp messages of at least 50 youths. They wanted to join these important sessions, Madam. But I think the link is freezed at 100. So that is a request from my side. And thanks for this thematic point of NCDs. You were part of all the last week where we had a round table on the NCDs. As you might be aware, colleagues, UNICEF is supporting 4 major NCDs: T1 diabetes, congenital heart disease, asthma, sickle cell anemia. And also in a broad way, we are supporting the mental health, particularly focusing on the adolescent mental health part of it. And also we are supporting the cancers. The first one of it is the cervical cancer, and we are supporting the ministry. We will be we have already started the awareness campaigns for the HPV vaccination, and once it is launched, I am looking at Dr. Hima Bindu Madam and Dr. Vasant Khalatkar will need your huge support for its rollout in the states, which will be decided by the Ministry of Health. So colleagues, this is a very good initiative where we now have the adolescents who will also speak their lived experiences, because we wanted to remove that stigma which is attached to all these NCDs. At the same time, we are also working to have the preventive aspects, improving the lifestyles, as Dr. Vasant Khalatkar has rightly mentioned. The Honorable Prime Minister has many of the programs, the Fit India movement, where we are looking at our youths and adolescents to have that healthy life. That it's very important that all of us work on the drivers of change, because directly at the morbidity and mortality, it will be difficult. For example, through the various studies, we have identified 4 drivers of change for the mental health of the students and adolescents. One of it is the family conflicts and issues, which is creating a huge mental health problem for our children. Academic pressures are there, interrelationship issues, and the perception. So these drivers we have identified for many of the diseases. We are also identifying the lifestyle barriers, factors for the NCDs and other diseases. So in this journey, we are all working towards making that future safe for the children and adolescents, and also looking at the geographies where we can have some of the physical consultations with the youths and adolescents. With these few words, thanks, Madam, for this collaboration and for this initiative on 18th of every month. We are standing with you for this very good initiative, and also some of the physical consultations to come. Thanks very much.
Thank you so much, Dr. Ali.
Thank you, Dr. Ali. And UNICEF has been a champion of child health. It started with newborn care perhaps 15 years ago, and now it's time to move on to adolescent health and extremely important aspects like mental health. And I'm sure when all stakeholders come together, the adolescent is well prepared to handle the outside world and become an adult and carry forward this initiative. A major stakeholder for us, and the one who drives all of us together, is the Ministry of Health. And I'm extremely grateful to Dr. Zoya ma'am for sparing her time and joining us today. She is the Deputy Commissioner of Adolescent Health at the Ministry of Health, Government of India. Ma'am, we're all very proud of you for the incredible work that Ministry of Health does. It's extremely easy for some of us to be stationed like I am in my own clinic, but then you are heading this entire health domain for this huge country. And we are extremely grateful for all the efforts by the Ministry of Health, and we pledge that each one of us will do our best to make sure that we contribute to your leadership. I now request you to please give your message. Over to you, Dr. Zoya Ali Rizvi, ma'am.
So thank you, Dr. Krishna, and thank you, Dr. Hima, and thank you, Dr. Nirmala, for having invited the national government. Also, thank you, Dr. Ali, and of course the other speakers who have spoken before me. I think it is such a joy to see that even though a country at large as ours, we have more than 25 crore adolescents, we can looking at what is the kind of potential we are going to tap into if we support them right now. All of you, not to preach to the choir, but also we are fully aware because a lot of young people have joined. So I'm so happy to see so many young people, adolescents have joined to contribute, to talk about the lived experiences also. So it is a very good thing which we follow, is that nothing for you without you. So if you have to be a part of all our planning, our interventions, our learnings also, that is very nice. Second, I would say it's really happy to see so many pediatricians who have joined. I can see so many stethoscopes also there. So you have joined, you have the passion of working for adolescents. So you have joined wherever and whenever you could. So that is such a wonderful thing to see this ownership from across such specialists who have such busy lifestyles. Next, I would say that on behalf of government, I would like to say that within the government, we have looked at creating a lot of comprehensive support systems for the young people, for the adolescents. We have worked on progressive policies. We've worked on, I think, very good flagship programs also. You may be aware about the Rashtriya Kishore Swasthya Karyakram and the School Health and Wellness Program. So just to quickly say that within the Rashtriya Kishore Swasthya Karyakram, we are looking at supporting these young people, these adolescents, by providing facilities which are adolescent-friendly health clinics, which are set up with trained manpower, which supports on counseling and commodities related to the various health interventions, including NCDs, lifestyle, mental health, injuries and violence, and sexual reproductive health, of course. So there is a lot of work which is happening at the facility. Now, if you move from facility out into the peer education within community, we believe that adolescents, the young people who have joined here, you are the ones who are going to lead the change. Because if we are engaging with you, if you're engaging with the young people, we are informing them on their own health and well-being. This is a wonderful initiative with peer education in which you are being trained to look at how do you look after your own health, what are the good habits, what are the habits you can improve, irrespective of how old you are, irrespective of your gender, where you are living, irrespective of your social status. All of this information is provided. So if you become a peer educator, you play a very big role in not just informing yourself, but also being a link between the young people around you as well as the service provision. So this is a big thing with peer educators are doing across the country. And also, I think you will play a big role in also looking at opening, having safe spaces, having open discussions on various critical issues which the upcoming times are going to, you're going to face those times. So whether it is mental health, whether it is safe spaces, whether it is talking about your own sexual reproductive health, whether it is talking about healthy lifestyle, those are discussions which you will drive because you will talk about your experiences and you will discuss and then come up with new solutions. Next intervention, which you may have heard, is Adolescent Health and Wellness Days, which are broadly events which take place in communities and schools quarterly, which are very wonderful because if I'm looking at pediatricians here, we do realize that we have to work together. So it's not just adolescents who have to work or their parents only, it is the adolescents, their parents, the teachers, the health providers like you, our own other health providers, whether it is the ASHA, the ANM, the support staff from ICDS, also Anganwadis, our counselors, our medical officers. So this is Adolescent Health Day, something in which all of them come together wherever they are. So whichever one is available works on adolescent health in creating awareness within the various stakeholders. And this also includes some kind of a good solidarity between generations. So their parents, their children, their grandparents, their elderly in the villages who are in the villages who are also involved in adolescent health days. So this is an intergeneration solidarity thing which we work on adolescent health days, and in which the peer educators, which I mentioned, play a very big role because they decide that what are the themes for the peer education, who all they want to invite. So we're looking at I would say, not just interministerial, interdepartmental, but various layers also of intervention to support the peer educators, and of course the adolescents. Besides this, we also have adolescent-friendly club meetings in which the ANMs, who are a field-level healthcare provider, they look and support at the peer educators. So they're supporting the peer educators in clarifying their doubts, in supporting them in actually talking to other peer educators. They are promoting cross-learning within the peer educators and also improving their knowledge. So everybody within the health system is being geared up, is being supported, is being trained to support the young people, the adolescent, whether you are in the school or in the community. Next, you may have heard of a program which is called the School Health and Wellness Program, in which outside of health, so health is doing so much, but then what about the other ministries and other departments? We have teachers who are being trained on health and wellness across 11 themes. And out of these 11 themes, which education has taken and partnering with us, 7 themes are directly related to health. So that is the importance which education has given health. And that is where we are training teachers to talk about these thematic areas, which includes healthy lifestyle, nutrition, sanitation, mental health, emotional well-being, relationships, safe use of internet. So anything which is affecting these young people is discussed by the teachers. And that we feel is a very big intervention which can go a long way. When we start in schools, we go beyond schools, and these young people who are interacting on these sessions with the teachers end up being informed young adults. And that is why this holistic development of children in schools by using teachers, involving parents, is something which is going to be an intervention which is going to be strengthened and supported in times to come. So briefly, I would say, just rounding up by saying that if we remove the barriers to education, if we remove the barriers to access to healthcare, provide opportunities to the young people who have joined here, and there is no way that there will not be an empowered young population for us who will be happy, healthy, reaching their full potential. And then that is what is going to push our country into a much happier, brighter, and healthier tomorrow. So whether it is the Fit India movement or Eat Right movement, we are in this together. And all of us have to together ensure that the young people are heard, are supporting the programs in which they only are the stakeholders and the beneficiaries. So all of us have come together. So thank you so much for having me. And I'll look forward to getting feedback on how this webinar went and what more we can do to support the adolescent and young people. So thank you so much.
Thank you, ma'am. Incredible work, incredible work. So much that's being done by the government. And it's not just in the health facilities, reaching out in the communities, working with education department. I think this is mammoth work. And we still have a lot to do. And Dr. Zoya ma'am, on behalf of all the pediatricians across the country, we commit our best efforts. We join this mission, and each of us will contribute our best efforts. Thank you, ma'am. We're incredibly proud of you and the entire Ministry of Health as well, because all this is a felt need. And as you have rightly said, there's a lot more that needs to be done, and we are sure we'll take it forward. Taking this forward, we now request you to please launch the module on NCD, which is hosted on Government of Andhra Pradesh webpage. I request Dr. Salima to please share screen for Dr. Zoya to officially release. And yes, and this is a joint collaborative of UNICEF Hyderabad Field Office working with the Government of Andhra Pradesh, IAP-AHA, and AIMS Mangalagiri. Zoya ma'am, if I request you to please declare it open so that it can be then clicked and it is available to everyone.
Yes, I declare it open. So happy to see so much happening.
Thank you, ma'am. Thank you.
Thank you. Thank you, Dr. Salima. And the right time for us to invite Dr. Nirmala, who has done a lot of work in the state of Andhra Pradesh, to please share her thoughts. Thank you, Zoya ma'am, for your kind words, and I'm sure you will enjoy the rest of the webinar as well. Over to you, Dr. Nirmala, please.
Thank you, sir. Thank you so much. And very good afternoon to all the dignitaries and all the participants. I'm really excited to join this webinar, and I'm very proud that I'm part of this wonderful program. Thank you so much for making me a part of your wonderful program. And under the leadership of our beloved Zoya ma'am, we are doing a lot of activities in the entire country, not only in the AP. And already ma'am has explained that regarding that activities. And as an initiative, we are conducting few programs. Like one of that is Adolescent Health Days. We are conducting Adolescent Health Days every month on the last Thursday. And one issue will be taken, adolescent issues will be taken, and we'll create awareness on the on that issue, particularly to the community and as well as in the schools also. So this is going on, and we are getting a lot of support from our dear ma'am, Zoya ma'am. So one more initiative I would like to explain it, that is this government of AP has made a significant progress in terms of implementing various adolescent programs, but one of that is the dedicated school health and wellness program website. And this was developed in collaboration with the health department, education department, that is AP-SCRT, and AP-SAGS, and UNICEF. And this has been developed as to serve as a one-step awareness platform for adolescent well-being. And this website is designated as a dedicated learning management system to reach public and private school students as well as the out-of-school students. We are focusing on out of school students also because we are missing out of schools. We are focusing more on in school. So we thought that these people are very important, and we are focusing on out of school children also. And then this website has been successfully hosted in live in government server. Recently, that process was completed, and now it is live on the government server. And the website of government domain, namely, it was formally launched on November 2024 by the Honorable Minister of Health and Family Welfare of AP in the presence of our MD-NHM, and all the secretaries have attended the program, that is from health secretary, education secretary, and from the women and child development. And other dignitaries also joined this launching program, and they are very happy, and they accepted it, and we are having regular review meetings with them so that we can have a convergence with all the departments. And this platform ensures that adolescents across the Andhra Pradesh have access to critical health and wellness resources. And this platform serves as an exclusive health and wellness hub for adolescent boys and girls, prioritizing their physical, mental, and emotional well-being. Now, so far, we have 17,600 adolescents have registered, and out of which 77% are girls. Primarily, they are from vulnerable communities in aspirational districts. That is one happy things we can say. And the homepage prominently displays key helpline numbers like Telemanas, that is regarding mental health, which is very important to the adolescents. And then the child helpline, HIV helpline, and the Adolescent Health Resource Center, which is located at AIIMS Mangalgiri in Andhra Pradesh. The State Adolescent Resource Center at AIIMS Mangalgiri, it is now operational, they are providing the specialized support and resources for the adolescent health. And then this module is developed, that is which ma'am has just now launched, that is NCDE module. It is developed in partnership with the IAP-AHA and the UNICEF, and it is successfully integrated in the School Health and Wellness website. And then upcoming e-modules we are preparing this on the preconception care, mental health, road safety, and HIV prevention. They are under development now, and very soon we'll incorporate in the website so that it will be accessible to all the adolescents. And one more thing, all of you know that convergence plays a very crucial role in success of any program. So every time we are having a convergence meetings with all the stakeholders, and regular meetings with all the departments. And one more thing is my sincere thanks to Dr. Zoya ma'am, Deputy Commissioner, Adolescent Health and Ministry, for her continuous support in encouraging and various initiatives to strengthen the adolescent health in Andhra Pradesh, not only in the Andhra Pradesh, in the entire country, which is very supportive, and we are grateful and thankful to ma'am. And our heartfelt thanks to all the partners like UNICEF, Salima. Salima is very supportive to us, and AIIMS Mangalgiri, AP-SACS, and AP-SCRT, that is a School Education Department, and now IAP-AHA. So, and for your unwavering support in empowering the adolescents and ensuring a healthier future in Andhra Pradesh and the entire country. So, and you empowering, you are the name itself is vibrating, and it is so excited. So thank you so much for giving me this opportunity, and we'll make the website accessible to all the adolescents, making them empowered, and awareness will be created through the website. Thank you. Thank you so much.
Thank you, Dr. Nirmala, and congratulations to the entire team. It takes a full team and dedicated efforts to take up extremely useful activities like this, and this website is extremely good. I request all the youth ambassadors to use your time very wisely, use technology well, and the best way to use it is to use it for browsing this website. You've got quiz, you've got useful videos, more material, and something that helps you grow better more happy and more healthy as an adolescent. And all credit to the government of AP for taking the mission of Ministry of Health, Government of India forward in the domain of adolescent health. And good wishes, ma'am, as you take up more and more programs in convergence with other departments. That now brings us to the technical module now, and I now hand it over to Dr. Himabindu Singh to please take things forward with her talk for Yuva on metabolic wellness and NCDs. And this will be followed by a deep dive into diabetes mellitus as well by Dr. Kiran Vaswani. We also have a little snapshot or a teaser of a couple of videos as well. And this is just a trailer of or a snapshot of the big amount of resources that you all will be having at your disposal. Over to you, Dr. Himabindu ma'am, to please take the session forward.
Start. Yeah. Thank you, Sri Krishna. While the screen is being shared, for this PPT, I actually acknowledge the presence of both the vice presidents. Can we have the message after this, because we want their comments also. And Dr. MKC Nair, our expert, is here. Basically, to all of us, the ministry is Dr. Zoya. Thank you so much for being with us today, and Dr. Ali. Basically, we are at the Adolescent Health Academy. We are having a lot of expertise within our group, and we are also looking forward for collaboration with the ministry and UNICEF and other partners. We are involving the youth ambassadors, and therefore we can see today crossing more than 100. Many of them are there in the YouTube link. So young people have joined. So we are want to work with them, along with them, and for them. So today we are focusing on NCDs, and we had a small metabolic wellness video. This we did as a workshop in our Pedicon also, and we would like to just showcase that. You can share from there. Where is it? I'm not able to see. Are you able to see my screen? Hello?
Ma'am, it's split. Can you
click
on the slide? Yeah.
I think you share. Stop sharing. Who's sharing this? Sri Krishna. Samir, Dr. Samir? You stop sharing. Dr. Samir, can you share it? For the want of time, kindly do it fast, please. Stop sharing.
Yeah, IAP-AHA, the co-host seems to be sharing.
This is Vivek. Vivek is sharing, I think. So I think we should
actually, there's
ask him
some
to stop.
problem. Some problem is facing. So, Dr. Samir, can you please share?
Yes, ma'am. Just a minute.
Yeah. So, meantime, while we had this video on, Dr. MKC Nair, sir, few words from you. This is an initiative by the AHA, a special initiative to celebrate Youth Wellness Day on 18th of every month. I request all the stakeholders to kindly come together so that we can make a big impact and take up these issues on every 18th of every month. Few words from you, sir.
Good evening to all. I will take only 1 minute, only 3 simple points. Number one, we have been the 3 panacea for good health and avoiding NCD is limited food, regular exercise, and a calm mind. And the studies have clearly shown that any intervention is effective only if we can mix these 3 things judiciously. Okay, there's one thing we should not forget, and that is we have a huge population of low birth weight babies who actually has been proved to have very high risk for metabolic syndromes later on. That means in fact, this has been my Doctor of Science thesis. I'll just tell you a simple thing. If you have birth weight, if you have a huge increase in the weight in the first year, you have the BMI, BP at 15 or 16 years, you can predict metabolic syndrome without having a cholesterol level. So that means huge number of children can be actually screened by this problem. Thank you. Thank you so much.
Thank you, sir. Dr. Preeti Galgali, Vice President, South Zone, Central IAP.
Thank you, Dr. Hima Bindu, and congratulations to IAP and AHA and UNICEF for the launch of these wonderful days. Happy to see a lot of youth being involved in our programs. So I know the youth being involved will cause a ripple effect in the whole society. And I also wish that parents and teachers are also involved to complete the triad, as I would, call it. And I would say, if you don't look into your body, where will you live? And also that includes the mind also. So all the best, and thank you once again for inviting me.
Thank you, Dr. Preeti. Now, Dr. Sabir, can you please move on to the next few slides? Dr. Prashant is here, Vice President, East Zone. Yeah, so coming back to our main thing today, the focus is on metabolic wellness. So I just want to briefly say that Adolescent Health Academy this year, during the Pedicon in Hyderabad, had launched a Well Youth Initiative. So this is going to be under the IAP as an action plan, and we'll be cascading in all the cities, most of the cities in India. So we have 5 priority areas in this action plan. So one is to focus on sexual wellness, which is a priority. The second is metabolic wellness. Then we have mental wellness, digital wellness, road safety, and vaccination. So we have taken up 6 priority areas, which in the priority areas, mandatory are sexual, metabolic, and mental wellness. So we'll just be showing us these slides we prepared for the youth and the pediatrician simple language, and hope this will be useful. Next slide, Samir. So we are going to touch upon this brief talk. We're just prepared for 15 minutes, but I'll be much briefer for want of time. So we want to just make the young people understand what is metabolic well-being and what are the markers, how to identify there's any dysfunction, and how does nutrition, stress, substance abuse, screen time affect the metabolism, and how to correct it and modify you so that you become metabolically well. Next. So what exactly, this is what we want to actually tell them, that please check your BMI. This one thing is a message which Adolescent Health Academy wants to give to the young people very, very loudly. So especially when you have risk factors in your family, when there are, there's overweight, there's hypertension, diabetes, and a lot of other, the lifestyle problems are there, and you're genetically predisposed, kindly check whether you are also on the wrong side. The best way is to look at your BMI. And look at the diet, look at your sleep hygiene, and look how much screen time you're actually going daily, you're being exposed, whether it is safe or not. Next. So next, you can click Dr. Samir. Yeah, so metabolic health, we want them to understand is how efficiently your bodies convert food into energy. Very simple. Next. It also is related to immunity. Next. It, of course, affects our mood, energy, focus, and even long-term health. So in this, you can see that how many factors play a role: diet and the stress management, exercise, sleep, even your social connections and how you're connected to the nature. All this will definitely help, has an effect on metabolic health. Next. So we have to ensure that we process the food properly, doesn't, without having negative effect on the sugar levels, cholesterol, and insulin. And this will actually, healthy metabolism will prevent development of lifelong problems, which can alter your body's function and relationship with, the comorbidities also can develop. Next. You can click faster, Samir. Yeah, next. So a lot of relation with physical health, sports, other aspects when you are not metabolically well. And we need to understand what is metabolic health, and it can also lead into syndrome. Metabolic syndromes can happen. So if you have good metabolic health, that means you're optimally functioning. And if it is abnormal and high risk, just Samir, go back. So when you are having high risk conditions and there's abnormal, then you can land up in metabolic syndrome. There could be risk factors in the presence of more than 3 and specific risk criteria there. Then you have to also think whether you are actually in the metabolic syndrome. So the implications would be a higher risk when you have a metabolic syndrome, whereas if you're metabolic, then there'll be a lower risk. So in metabolic syndrome, actually, there's a cluster of conditions that occur together. And the end result, of course, is a metabolic dysfunction. There'll be increased risk of heart disease, stroke, and type 2 diabetes. Next. I hope I had the control in my hand. Yeah. So we need to really take care of our metabolic health. It is in our hands whether it is healthy or it is going into dysfunction. You have to take care of your lifestyle, whether you have the right dietary choices, and especially if you're high in junk foods, naturally you are maybe getting into a wrong metabolic health. You're leading to wrong metabolic health. Lack of physical exercise, inadequate sleep, higher levels of stress, and higher screen time and substance abuse, all these factors, lifestyle factors, can affect your metabolic health. Genetic factors also have a role, and of course, your hormonal changes can also have an impact on the metabolic health. Next. So, how to measure? How do you know that you're metabolic? So you can track your biomarkers, especially your BMI and waist circumference. Please see that you get your blood pressure. The youngsters who are watching this webinar today, it is for you. Very simply, all the pediatricians and experts have just, this is all the knowledge which you have got this into the slides, that we want you to do at least this much. Check your BMI. Please go to your pediatrician today itself and as early as possible within a week, because this whole 1 week is for the youth wellness week. So please check your BMI in this week at least. Check your waist circumference. If the blood pressure is also checked, well and good. And you please look at your blood sugar and lipid profile. But at least your BMI. That is the message. Next. That will let you know whether you are in the right, we have this BMI charts, we have different, WHO, IAP guidelines, all this has come out, but we are following this as the cutoff for the different age groups. Next. For the Asians, next. Yeah, next. So now we are going to the lower level, 22, 23, we are looking at this, we say it is overweight and obesity. Obesity is an extreme form of overweight and, extreme form of the, when there's a lot of derangement, it can lead to obesity. It's actually a very, very big public health problem. The incidence of obesity is increasing, it actually tripled in the last 4 decades. You can see even kids are becoming obese. It's not, earlier we thought obesity, lifestyle problems are only above 40. Now even young children are being affected, therefore the pediatricians are really concerned. So we want to join this global call on preventing NCDs by handling catching them young. Next. So marking their weight is very important. So looking at the growth charts and weight monitoring at regular visits by the pediatricians will help them. So how to improve our metabolic health is by having healthy eating habits, fruits, vegetables, whole grains, avoiding junks. Very, very important. Regular physical activity of at least 1 hour, moderate to vigorous. It could be sports, yoga, anything. Kindly, we need to incorporate this in our lifestyle, in our day-to-day. Youngsters, please note 1 hour of exercise. And please sleep for at least 8 to 10 hours. This, I think we are really curtailing because of screen time. A lot of, we always have some reasons to say why I'm sleeping less. But adequate sleep is very important to prevent the metabolic problems. Reducing the screen time and managing your stress by being more organized. Your study time, the time management has to be good. You have to learn good life skills, study skills to manage your time and organize yourself, and healthy stress management techniques and regular checkups are very important. So eat well, sleep well, exercise well, watch well, live well. So this is all about wellness. Next. So eating well, what does it mean? The concept, it's a rainbow plate, what we are trying to say. So your plate should look very colorful. So the food should have micro and micronutrients, lot of what is needed, avoid junks, and please get to the habit of reading the labels before you purchase anything. No Zomato, tomato, all that we order food at, and it comes within 2 minutes and 10 minutes. How can it be fresh? And we don't want this, that I have a lot of, it is not good food, not healthy for you. Homemade food is the best, and we have to get actually like this food. We don't like home food. Na? The youngsters, they को bore लगता है. So उनको जब बाहर का food अच्छा लगता है, but they don't understand they're taking the wrong food into their stomach and the metabolic syndromes can develop. So this is how your plate should look. How much fruits and vegetables you can see, it's half of your plate. And the others are grains and proteins. So protein content also should be focused on. So beware that you are actually taking the right amount of protein or not. So junks do not have, they're all, they don't have any macronutrients. So this really hampers your metabolism. Next. definitely they're tasty, but they're very unhealthy. So please look at, they contribute to obesity and poor metabolic health. We request you, the AHA and IAP, from our fora, we request our youngsters to please avoid junk foods. And they're really so harmful. You do never know, you will just, how much of calories you're taking. It is very, very shocking. We need a separate webinar to deal with this. So we don't have the coloring agents, the testing, all these are sometimes cancerous too. So we don't want our young people to get into all this. I request you to make your home food interesting. Please get involved into the kitchen. You shop for yourself what you want, and involve with your family how to cook healthy food, and have your party time around your homemade food only. Next. So these are the tips. Avoid junks, and if at all, just maybe once in a week. And the best drink is water, not Coca-Colas. All our parties have Sprites and Coca-Colas. The best drink is water and water and water. Don't mix meals and screens. No eating and watching TVs. And read the food labels. Avoid the trans fat. Limit the free sugars to less than 5%. Prefer whole fruits, not juices. No fruit juice in illness. When we think that bukhar aa gaya, and then mummies and all, they give all fruit juices. So this is not healthy. Tea and coffee is only maximum 1 cup per day. So this is what we are advising and recommending from this forum. Next. So very simple. Please take care of the insulin. This is a hormone in your body. This is the key to energy control. This actually moves the sugar from our blood into the cells. It works for the fuel like a pump. And healthy insulin levels are important because they function. The insulin helps to prevent condition like type 2 diabetes. Very essential. Insulin is very essential, but we should not develop insulin resistance. So we have to we have to look at the factors what are actually causing insulin resistance. To prevent this, we require healthy lifestyle. Next. So the problem is too much sugar. So we are like carbohydrate rich diets. We take either North India, South India, either it is rotis or rice. Both are rich in carbs, refined carbs especially. This will cause spikes in your blood sugar, and this will actually is not good. This can lead to insulin resistance on the long run. So this will lead to type 2 diabetes. But we can see that we say mature onset diabetes. We are seeing this quite early now, even in the second decade of life. So the pediatricians are really concerned. This was supposed to be once upon a time a disease of the aged. Now we are seeing in the second decade, adolescents and even young children are being affected. So we need to be cautious about the spikes of sugar. So this should not happen with our food. So our food is predominantly carbs that we need to avoid it. Let us increase our proteins instead of the carbs. Next. This is in short, in simple messages for the young people. Please take care of exercise. Please, we need to walk more. Next, we need to walk more. We need to stretch more. We can involve in sports. We can involve in yoga, meditation. That's also good for your stress management. See, minimum 1 hour, moderate to vigorous exercise we are recommending. Outdoor games are the best. Whole body should be involved. Jogging, swimming, dancing, aerobics, Zumba. You can do whatever you like. Lifestyle, you try to see whether you want lifts or climb the stairs. Please involve in your day-to-day activities, walking, cycling, short distances, yoga, Surya Namaskar. At least this one you practice and do. It will help you in stretching, flexibility, focusing, a lot of benefits with this one. At least one Surya Namaskar in yoga and stress, this will help us. And you can see the benefits. The same, the release of happy hormones, there's a lot of fitness, weight check is there, the brain agility improves, the memory power improves. We all love to be energetic. Yes, young people, we want to do good in our sports. We want to get good marks. So we need to be take care of our brain, which is important. So this exercise will help us in developing good memory power, good stamina, and it also helps us in learning life skills. And it will help us to become more creative and constructive in our work. Next. Lot of benefits with exercise. So let us move out of our couches. Let us run. Children and youth, please run. That's why we say walk the talk, walk, walk, walk. Yoga and meditation is not something for the old people only. It is for the young people, for the children. We need to actually get them into their day-to-day daily life. This will improve the physical health, enhance the social emotional skills, Better sleep patterns are observed. They have healthy coping mechanisms once they get to the habit of this yoga and meditation. And sleeping, as I said, 8 to 9 hours of sleep is extremely essential. Both the quantity and quality are important. Good sleep will improve your memory, concentration, cognition, and performance. It also helps in weight reduction. Do you know that? If you sleep well, you can reduce your weight. It reduces the acne and skin problems. Sleep deprivation will lead actually to mood changes, and you can become irritable. There could be higher risk-taking behaviors, behavioral problems, fighting, maybe because of sleep deprivation, poor concentration, memory power, deteriorating academic performance, drowsiness in the classes and while driving. All this can be due to sleep deprivation. So please sleep well. Next. Sleep hygiene, extremely important. Please avoid the screens before you go to sleep. And whatever you're watching on the screens, kindly be vigilant. So screen time must not replace other activities like outdoor physical activities, should not replace your sleep time, family and peer interactions, should not replace your time for studies, skill development, which are very, very necessary for your overall health and development. So 8 tips are there, to about the smartphone habits. You can see on that, prioritize your core, the mindfulness. Then you can, this is the, if you, the lot of problems with the screen, misuse of screen. There's a very big topic that can lead to lifestyle problems like hypertension, the heart disease, dementia. These are lifestyle problems. Insulin resistance develops because of sedentary habits, lipid problems, type 2 diabetes. These are all the follow-out actions. See on the right side, you can see those tips, strategies, like, what we can do. Thank you. Next. Watching well is important, what you're watching. Substance abuse and metabolic have a relation. The substance, what itself actually affects the body, whether it is smoking, whether it is alcohol, any other substance which is abused, which is not healthy for you, can have negative lifestyle changes. It can also lead to irregular eating and poor diet, and it will, opium affects your gastrointestinal system, causes a lot of diarrhea, vomiting, etc., and can result nutrient and electrolyte imbalances, and other stimulants like cocaine and cannabis can actually reduce the appetite and leads to weight loss and poor nutrition. So please avoid all the substances which are not good for you. That especially what I'm mentioning about alcohol and other cocaine, cannabis, etc. Next, can derange your metabolism. So consequences of substance abuse, you can see that it can affect your studies, and you can get into law and order problems. It can actually totally take you away, and you'll be so addicted that you will not know you're going. You may be aware, but still you can't come out. So you may require professional help. Please seek help. Don't hesitate to open up and talk about it. So mental health is extremely well related to metabolic health. So impact of stress on metabolism, because they are interrelated. If you're good mentally, your metabolism is also okay. So what we can do to handle the stress. So to see that stress is not impacting on metabolism, you need to organize your study pattern and inculcate good life skills, build up your resilience. You need to build up your tolerate and try to bounce back. All your lows and ups in life. After low, there's a high, definitely. So we need to have resilience to cope up. Then practicing relaxation techniques will help you. Do group projects with peer groups. Involvement in all social activities will also help you. The cortisol, if it is, when the stress can lead to increase in cortisol, this can actually affect your blood sugar levels, can your memory and attention, increase your blood pressure, and, this can suppress your immune system too. So we don't want your cortisol to be too high. Little bit high is stress is okay, but this stress, where the cortisol is too high, can impact your metabolism. So please take care of your mental health too. Next. So how to recover from stress? Again, exercise, a very good stress buster. Mindful breathing, and you can just at least express. Don't keep it everything. Express. You can cry and then at least be relaxed. Creative expression you have to learn. Hugging with your known people, with those who can trust, will actually help you. Have enough sleep, have a good laughter, just laugh it off, and be with your nature. Connect with the people around whom you love, and connect with the nature around. Look around. Then these are few stress busters which we are recommending. You can have your own stress busters. We have done a survey to understand what are the various stress busters for everybody. We'll reveal all that to you very shortly. So metabolic well-being and mental well-being have shared pathways. They can both lead to poor metabolic health. They can affect each other. So mental health challenges can lead to poor dietary habits. Nutritional impacts are there. So therefore, emotional eating can happen when you're mentally disturbed. You can eat more or eat less. Both can happen. So this diets when you're eating more can be high in sugar, because that gives you immediate, you like it. When the high sugary foods can actually, when you are in depression or when you're feeling low, you feel nice when you take sugary diets, but actually it's not healthy. Then unhealthy fats can actually negatively affect your mood, memory, energy levels later. So balance your diet with rich in omega-3s, vitamins and minerals, but will actually support your mental well-being. Next. So we can also help our friends to improve our metabolic health. So we know when we are saying collaborate to learning, young people, please help each other. We can spread the awareness about NCDs, of you being you metabolic. That's why we are celebrating 18th of every month for you. Please spread this among all your young groups. Do group activities. You have study buddies, planning healthy lifestyle days and weeks, group sports and exercises, sharing healthy homemade diets. You can actually, while we share so many things, why not share healthy homemade diets? Making posters and paintings, all this creativity which is there within you, please bring it out and share among your friends. Next. So please understand when to actually identify you are in a metabolic dysfunction. When you have increasing weight, easy fatiguability, poor concentration, deteriorating academics or sport performance, craving for food, frequent craving, frequent headache and irritability. These are the red flag signs. Please check BMI. Please go to the pediatrician. Check for yourself. Next. There's always, we can reverse it by having healthy lifestyle. Yes. Next. Prevention is the best policy. We don't want you to get into that, type 2 diabetes and other comorbidities, heart attacks and, hypertension, so many other problems. So here are few rich. Pack lunch. Take your homemade, carry your meal. Please take care of. So when all the young people love to have parties. So whenever you're planning to dine out, again, plan that it is homemade or good, healthy food. So with this, I think these are the key messages from the AHA side. So I request, so batch cooking, these are the few tips. Next. So these are the, all of you are tech savvy. So a lot of healthy apps are there. Now, Dr. Sri Sailam will tell us, now we are also having some 100 days challenge, which he wants to announce. So on part of AHA, we'll want to engage the youth in involving all the tech apps what you have. Please get into that and watch your steps, how much physical activity you're doing, what is the diet you're taking. Please report to us and we'll all help you and guide you. Thank you so much for giving this opportunity. And we hope that we celebrate the Youth Wellness Week throughout from today, next 5 days. I would love to see a lot of activities happening throughout the country. Thank you so much.
Ma'am, can we move on to the next talk?
Yes.
Deep dive into diabetes by Dr. Kiran.
Dr. Kiran Vaswani, she's a senior pediatrician from Navi Mumbai, one of our core groups in AHA. And she's actually, well known for working on metabolism. And her work is basically on diabetes. So she'll be speaking on deep dive into diabetes, which is another dysmetabolic entity. Deep dive into diabetes by Dr. Kiran Vaswani. Over to you, Dr. Kiran. We have one video by Dr. Richa and Dr. Smita. It is a very big video. Hope we have downloaded it. And if we have time, we'll definitely play that and we'll share in the group. So it is very beautiful, a song given by Smita Mishra. She has created a song very, very innovative. She's from Delhi. Both of them are Delhi and they are president and president-elects in Delhi branch. So we'll be trying to play that video after Dr. Kiran's session. Over to you, Kiran. Unmute.
Yes. Thank you for this opportunity. I have tried to do something which does not overlap. Same time, I would like to thank Dr. Himabindu for setting the foundation for my lecture now. So I have tried to focus more on the management part, and since it's a youth program, I know they want to learn and will implement things when it comes on a scientific basis. So I have tried to include a few relevant landmark studies which will go to prove or to make them understand why I am giving these things. And in the end, I will give you a few key suggestions and messages. So, I'm not able to, it's not moving forward. How do I go about it? Can anyone help me?
Did you share the presentation, Kiran, with anybody?
You can't see. No, I have not. But can you see my
yeah, we are seeing your
screen?
slides.
Yes,
ma'am.
yes.
We are able to see.
Move करो मैम आप. Sorry?
आप move करो
मैम. Move कर रही हूँ, लेकिन shall I share it again? Probably that will help. Let's.
Yeah.
I'll do that.
Because we have other.
Yes, I'll do again.
Dr. Shailaja Mani's installation is there at 4:30, Maharashtra, AHA.
Or should we try it like this only? Is that all right? Okay.
So please carry on, Dr.
Just a
Kiran,
minute.
for want of time. Please carry on.
Yes. I'll just try once resume slideshow. If it moves, it's all right. Yes, great. So we will just try to see the magnitude of the problem, its implications and complications. Just in brief, it's there everywhere, but to understand how much significant and serious it is, I'm trying to focus on a few relevant statistical facts. There is a significant burden, estimated around 101 million people living with diabetes in India and another 16 million at risk of prediabetes. The most surprising and the alarming point for us is, as Himabindu already mentioned, young adults' diabetes is on rise. About 25% of newly diagnosed diabetes are with type 2 in their early 20s and 30s. And another category is an undiagnosed diabetes. They do not know, so they do not get the attention, treatment, and care. In India, 20 to 79 years population, 74.9 million in 2021, which is predicted to something wrong there. Huh? Don't go by that number. So these are few important points. 1 out of every 7 diabetic adult in the world resides in India. Is it alarming? Are we proud of it, or we need to work on it? 1 out of every third household in India has a diabetic person. Increasing prevalence between age 20 years is from 5.5 to 7.7 in 2016. I think my laptop ka one doesn't work well, so that's why I'm getting these numbers crazy. In 15 and older age, 16.1 prevalence. Now, this is a very interesting fact. We think youngsters have mainly type 1 diabetes. So in 2023, out of 864, it has grown 6.57% annually. We have a young diabetes registry. That is one very good thing for youngsters. We have a registry from 2006. All those who are diagnosed at or before 25 years of age are in this registry. And if we were to see of 20,351 who were registered for type 1, only 65.6 were type 1. What about the rest below 25? This is the huge chunk, almost 7,000, 35% is type 2. So this is very alarming. At the same time, probably it also means that if we work on the modifiable lifestyle factors, we can give them a good reversal or remission. Complications, just to mention, they are at different levels. Physical, we are all aware. Mental level, social and financial. At the physical level, most important are macro and microvascular. Not to complicate the things, it means in the kidneys, in the eyes, in the nerve endings, or in the cardiovascular system, cerebrovascular system, having heart attacks, strokes. Because there are youth members also, I might like to simplify what I have said there. So the complications can end up with limb amputation. It can have blindness because of retinopathy, kidney complications landing up in dialysis and renal transplants. Then what is not mentioned here is almost every organ, right from liver, lungs to any organ you name, diabetes can go and bite a chunk out of that organ. So it's very important. Cardiovascular may heart attacks, cerebrovascular strokes, then peripheral vascular where you do not know you have got injured and you end up with your limb amputation. Eyes and kidney are other things which we need to be aware of. So there are different diagnostic criteria. Most important is to remember that diabetes, we will just focus on HbA1c being more than 6.5%. Between 5.7 to 6.4 is again pre-diabetes. That means they can go to, it's like a Humpty Dumpty sat on a wall. It's on the wall. They can remain there for long. They can come down and be reversed in good normal range, or they proceed to diabetes. So let's focus on both diabetes and pre-diabetes range here. So in brief, evidence-based guidelines for diet is low fat. Let's focus on whole food plant-based. What does that mean? It is whole food. Means it is food which is not processed. Okay, which is not refined. And plant-based is less of animals. I will go on to show that how much this pattern of food helps you in reversal and remission. The plate method is the best way to find out what we are eating without focusing on the calories. If it is whole food and plant-based, you cannot overeat. Only the dense calorie foods can be overeaten because the stomach doesn't feel full. Secondly, you cannot overeat if you do not have a screen in front. Your satiety center tells you where you have to stop. So the plate method says half the plate is full of non-starchy vegetables, 1/4 with starchy foods like cereals and a few starchy vegetables, and the 1/4 is with proteins. Proteins are all your protein-rich foods like dals, beans, lentils, and a few non-veg foods for the non-vegetarians. But remember that the non-vegetarian proteins come with a package of a lot of fat in it and very few fiber elements in it. So focus more on whole food plant-based. A little of these can definitely be taken. I'm not insisting on having only plant-based. It is plant-based predominant. Water or other calorie-free beverage is the only beverage to be taken. So nutrition recommendations are to reduce the intake of dietary fat, processed and simple sugars, sugar-sweetened beverages, and processed grains. Increase intake of fiber. See, like we say in pregnancy, the mother has to eat for herself and the young fetus that is growing in her womb. Similarly, all of us individuals as human beings, I think we need to eat for ourselves and the microbiome in the gut that we are nurturing. And the fiber is the thing that nurtures the microbiome. So a healthy microbacteria in the gut gives you a lot of benefits in mental health, immunity, and metabolic wellness. So from today, focus on this one point, that we are eating for ourselves and the lovely trillions of microbacteria that we are harboring in our intestines. Also focus on GI and GL. What is GI? It is glycemic index. It's just, I know all doctors know about it. For others, non-medical persons, I would just like to give a few points regarding glycemic index. It shows how fast and how much of intensity the sugar rises if you eat a particular food. So it is compared with glucose. So low GI foods are all whole foods. Refined foods are all high GI, because once they enter the gut, they just have to release the sugar they have. Whereas low GI foods, like what I said, the unrefined or whole foods, have fiber in them, which will control the rate and the intensity of increase in the sugars in the bloodstream. Fruits are usually high GI, except for a few, but then since they are rich in micronutrients, we should take them, but in restricted quantities. Let's not indulge in lot of fruits. So if you say 5 servings of fruits and vegetables are recommended in a day, it should be 1 or 2 servings of fruit and all others as vegetables. So healthful plant-based diet. Nowadays, there is a fashion or a fad of saying I'm a vegan. Believe me, even vegan foods, which are lacking in animal foods, can also be unhealthful. All your sugars and refined foods that you eat are also plant-based. They can still be plant-based. A bread, a biscuit, all these are plant-based, but then they are unhealthful. So you can add a lot of sugar, salt, and oil to it, and it becomes unhealthful. So these are a few illustrations of plates for health. If you focus on each of them, you will find that they are in 4 quadrants. One is a cereal or a grain. The other is dal-based foods. Third is vegetable as a cooked vegetable. And the 4th is a salad. You can add a lot of sprouts to it. You can have only dal-based breakfast, so that you increase more of proteins and reduce the grains. So rainbow diet, this is what is called rainbow. So what I say is add colors to life, but not artificial paints. So many children who come to me, they say, yes, we have colors in our food. Ask them what.
Dr. Kiran, can we have a few minutes, please?
Yes, yes, I will do. When you ask them, what do you have? They say jam, squash, jellies, sauces. All these are artificial colors. So make it very, very clear that you are having natural colors from the nature. I would like to focus a little bit on exercises. There are relevant many studies which show that exercise is the thing to maintain a good metabolic health. So there are 3 or 4 parts to this, especially for everyone, but particularly for diabetes. Physical activity is to lose and maintain an appropriate weight, but then also important to understand that we have to reduce the total sedentary time. So if you do good exercise for an hour, are very, very active, and sit sedentary for more than 50 or 60 minutes, you have lost the benefit of that physical exercise that you have. If I were to ask you, can anyone tell me just on the chat, is there a difference between physical activity and exercise? Just say yes or no. Y or N, can you type? Otherwise, let me tell you, physical activity is anywhere you just move the muscle, skeletal muscle. Whereas exercise is a separate subcategory of physical activity where you do something with a purpose, repetitive, planned, and structured. Okay, so purpose is to maintain fitness, improve performance, and health. So in type 2 diabetes, to prevent or delay onset in high-risk population, at least 150 minutes in a week of moderate to vigorous exercise with dietary changes to result in 5 to 7% of weight loss helps. So the next point is, don't skip exercises for more than 2 days at a stretch. Adults, both aerobic and resistance training. I have heard many of the people saying, yes, we do exercise, we walk. Walk is not an exercise at all. Brisk walking, Zumba, all that, but you also need to do resistance training. That is another thing. You need to improve your muscle strength.
Dr. Kiran, how much time?
I'll end it in another 5 minutes, I suppose.
2 minutes, yeah, please.
Yes, children and adolescents, age appropriate, 3 to 5 years, they should be physically active, having active play activities, not on the screen video games or anything like that. And there is no specific resistance training recommendation for this age group. They should be always active. 6 to 17 years, 60 or more minutes per day of moderate to vigorous intensity aerobic exercises, plus muscle and bone strengthening, impact on bone activities. So these are tug of war, squat jumps, jump rope, climbing. Weights or heavy loads should be under strict supervision. Adults 8 to 64 years older or more old than that also, again, you need 150 or 300 minute vigorous exercise and resistance training 2 to 3 times per week on non-consecutive days, and add flexibility and balance training to especially in older adults. Exercise studies, there's one. Diabetes.
Dr. Kiran, we need to close, yeah.
You'll need to give me a few minutes. We said 15 minutes and my important slides are at the end. I'm not taking 15, but let me have at least 10 or 12 minutes. Okay, so these studies, I'm not going in detail, but exercise in type 1 diabetes, I will say, what is type 1 and type 2? The major difference in type 1 and type 2 diabetes is type 1 diabetes have a deficiency. They are lacking in insulin, so we need to give insulin for their treatment. Whereas in type 2 diabetes, for various reasons, their insulin is in excess, yet the tissues are not responding. So, in exercise point of view, youth and adults of type 1, it's recommended for all, but responses are highly variable. So you need to have checks and then only suggest such exercises for them. Points to note or take care is, if the sugars are between 100 and 250, exercise is recommended. More than 250, check for ketones, postpone exercise if ketones present. More than 350, test for ketones, postpone if ketones present. But if in trace, consider corrective dose. Less than 100, give a snack of easily absorbed carbs. It's 10 to 20 grams, again, sorry for that. Carry extra carbs plus decrease 50% of short or rapid acting insulin around exercise time. Adults or even youngsters with these complications need to take care, especially the ones with neuropathy need to be alert and avoid outdoor exercises. There are many studies, like I have mentioned here, who say that in type 2 diabetes, with a proper lifestyle management, within 7 days to 3 months, the diabetes profile can be reversed. So I'm not going into the details. It's very interesting though, but not going into the details of these studies. Well studied, documented, evidence-based. So you should include self-management, education and support, medical nutrition therapy, physical activity, smoking cessation and counseling, psychosocial care, and comprehensive medical evaluation regularly to manage the comorbidities. Physical activity per dietary advice, and we said this. Screening is done just in 3 points. If there is a first degree relative with diabetes, high risk race or ethnicity, for that matter, all we as Asians come in that. Any history other than this, they should be done anytime. But if there is no such history, do it once in 3 years after 45 years of age. Additional investigation in type 1 will be to check C-peptide, which is an indicator of insulin production. Sleep, as already mentioned by Himabindu, most important is circadian rhythm disturbances, not just the duration. When you go to sleep is also important. That otherwise it will need higher nighttime cortisol, glucose levels, reduced insulin sensitivity, and higher blood sugars. And most important is the role of leptin there. It will increase the craving for carb-rich food. Okay. Smoking, diabetes risk increases, relation with emotional health, depression has a bidirectional association. I have come to my last 2 slides where I have focused on a few suggestions and key messages. Focus more on whole foods, plant-based. Avoid processed foods for sure. Hospitals can start avoiding serving biscuits, bread, or milk as mid-meals, giving high GI fruits as breakfast. Why do we insist on too early or frequent meals in diabetes is a big question mark. Frequent meals increases your insulin resistance. Increase dal, sprouts, veggies, and millets. Add soaked seeds and nuts, everyone. Very good source of micronutrients and omega-3 fatty acids.
Yes, sir.
Exercise breaks is a
few minutes.
Yes. Exercise breaks is a must everywhere. Mental health support, sleep and smoking also important deciding factors. Learn to march from screen to green. Most important is a gratitude journal keeps you very, very positive. You will start appreciating what you have rather than looking at what you do not have. Breast milk, catch them young. It should become similar to safe touch and unsafe touch. You should make them say, this is safe food, this is unhealthy food. I should take this food, I should avoid this food right from a young age. Teach them care and love for nature. It will help prevent air pollution, which is another important cause of NCDs. Growth charts. I cannot overemphasize this point. Especially Dr. MKC said, the low birth weight babies gaining a lot of weight, we should be alert. Frequent exercise breaks, add colors, plant and plant. Make a difference between what comes from a tree plant and what comes from a factory plant so that you become closer to farmer or pharmacy. Water is the best beverage. Label reading. Whatever food has a high, long shelf life is not good for you. Celebrate with outing and togetherness and not with kuch meetha ho jaye. I think that's the end of it. Thank you. Thank you for being with me.
Thank you, Srikrish. Over to you. Oh, thank you.
Yeah, thank you. Thank you, ma'am. So that was a very informative session. And now we move on to the youth voices. And I now invite Naumita Khanna and Venkat Kalyan to please share their experiences. And I hand over the stage to the people for whom all this is meant for, the youth of India. Over to you, Naumita.
Okay, thank you so much, doctor. And I think I got a lot of insights as a person and actually as a youth with lived experience to how to manage type 1 diabetes. And yeah, I'm going to talk about my lived experience as follows. So, yeah, am I audible?
Oh, yes, please go ahead.
Okay, great. So, good afternoon, everyone. It's so good to see all of you dignitaries here. And my name is Nomika, as you all know, in the Zoom screen. And I stand before you as a lived with youth experience with type 1 diabetes. You all know that it's a NCD that's expanding day by day, second by second in India and abroad too. So, I was diagnosed, actually, I was born completely normal. I was diagnosed with it at 7 years of age. And an year later, I developed a comorbidity that was hypothyroidism. Then, at 15, epilepsy struck me like a lightning bolt. And at 23, I also had to undergo a major neurosurgery where 11 parts of my brain were burnt. So, quite a lot, right? So, thus, my life changed overnight from being completely normal to having 4 injections a day, lifelong medications, and the emotional toll. Just like many of you said, that the role of mental health of chronic illnesses welcomed me at their feet. I still remember one night as a child lying in my bed, scared, alone, my heart full of palpitations. I felt that I was stripped of all the choices and bombarded with so many decisions like adults, but I was still just a 7-year-old child. The initial fear and the stigma of getting a diagnosis of a type 1 diabetes, especially in the Indian context, cannot be underrated. And I think that all of us know why. So I learned that diabetes does not discriminate across cultures and, across even various states across India's, and is actually a silent killer. You may not die of diabetes alone, but you can or may die of various comorbidities that it comes with. So I also remember how no one would like to take responsibility of a so called sick girl in my childhood. For example, so at school, I would tell you, some teachers thought that I was faking my condition to avoid exams. Some classmates refused to sit next to me, believing that diabetes was contagious in nature. Such a myth. So, also, my adolescence was stripped away by long queues of doctor visits, medications, and societal judgment and stigma. In India, to be a man with type 1 diabetes or type 2 diabetes also is one thing, but to be a woman with diabetes, especially type 1, is a whole other universe. Once diagnosed, she is often seen as a kind of something that's, damaged or defected, or maybe unfit for some job or unfit for marriage also. Still, I promised that little Nomika, 7-year-old Nomika, two things: to never give up and to advocate for society's well being. Today, there are some words, in fact, a quote by Helen Keller that's very famous, which guides me. Although the world is full of suffering, it is also full of overcoming it. So, as a youth champion from UNICEF, with lived experience of, you can say, so many NCDs, I know that type 1 diabetes and epilepsy are often misunderstood, overlooked, and burdened with stigma. And most often, type 1 diabetes and epilepsy also come with its mental health challenges. So, as a type 1 diabetic advocate on a regional, national, and also once I got to a global level, I have at least tried to bust myths about type 1 diabetes and made life saving tools available through Blue Circle's Diabetic Foundation and diabetes. Also, in my society, I have empowered to a lot of extent all the three genders in the diabetic community through, of course, Blue Circle Diabetes Foundation. And also, like I said, that the childhood is quite, problematic there. And many of you said that there are family distress. And as a master student in psychology and child psychopathology, I could very well relate to that. So, I have tried to build peer support networks where no one feels alone in his or her journey through child, through adolescence, or even through adulthood. So, and also welcoming people from all walks of life to accept diabetes. Do not deny diabetes, it's not a condition. You need to accept it in order to move ahead with that. Moreover, so in short, I think the saying goes that by a very famous Mexican poet that I once got to know at Kigali, that they tried to bury us, but they did not knew that we were seeds. And also, I just got to know the gory truth that the doctors highlighted here, that NCTs, that is type 1 diabetes, is a major source of, deaths. And 1 in 5 adolescents, in fact, 75% of the premature adult deaths and psychiatric psychopathologies begin due to unhealthy habits that is acquired in the youthful years, which I see also in the other people. Also, LMICs like India are faced with a lot of troubles. First, to combat type 1 diabetes, and second, to also face various issues and, like mental health issues and infections. So, in terms of mental health issues, which were highlighted here, I would like to talk that. There's something known as diabetic distress. That is the emotional and the mental burden of managing diabetes, leading to feelings of fatigue, leading to feelings of frustration, leading to feelings of a kind of diabetic burnout, and then the anxiety about the condition, the stigma, and various other things that comes with it. So, moreover, various other mental illnesses like depression, suicide, which could be worsened by factors like especially if somebody lives in lower socioeconomic strata and if somebody experiences domestic violence, poverty, and stigma and discrimination. I would like to just say that insulin is my oxygen, yet many children in India die without it, die without even a diagnosis, especially in the rural areas. So, CGMs, which all of you might know, is very vital for control of diabetes, remain still a luxury than a necessity. How is my survival or even the other people's survival in the rural areas? I do come from a different strata, but also thinking about the psychosocial aspects, still a privilege. Caregivers today endure the endless stress and the trauma of managing sugar levels continuously and having emergency of the hypos and the hyperglycemias, which you all know, and the financial strain. Others remain sleep deprived. There's also a lot of researches and reviews of literature which do say that diabetes kind of make you sleep deprived and make you emotionally drained. They bear the invisible burden but remain their child's unwavering support also. All over the world, not just in India. Last but not the least, I will fight back because why not is the title of my poem. I wrote it years back when I was very small and I would just like to, read it out loud. So, when I'm up against the trouble, I meet it face to face. I lift my chin up and set my shoulders bold. I pull my socks up and take a brace. Do the best that I could do. I know that I might fail but might conquer something else. Candy cloud for others, why black for me? My future may seem grim and that of broken shards, but I keep telling myself to keep fighting. Because the worst is that I would fail. Running from fear itself would not save me. Sometimes hope does seem futile, and others may turn their backs in society. But remember, what you're facing is something exceptional. So keep your eyes front, head high, and don't let your crown slip, princess, prince, and even the other LGBTQ society. And there's a very famous quote in Hindi that I would like to say. लहरों से डर के नैया पार नहीं होती and कोशिश करने वालों की कभी हार नहीं होती. Done.
Thank you, Naumika. This is incredible courage, perseverance. All credit to you and your entire support group. I'm sure your family, your friends, everyone
Wow.
at UNICEF. Wonderful, wonderful. I know you've quoted a couple of people, Helen Keller and a Mexican poet, and a wonderful poem you've told us. I'm going to quote Naumika whenever I talk about diabetes henceforth. And you're not alone in this fight. I recall Alexander Zverev, who was a type 1 diabetic since the age of 4. And he's a tennis champion. And I'm sure there are more champions amongst us who have the ability to face challenges, defeat the disease, and still emerge victorious. All credit to you and good luck to you. The fight is not over yet, but I'm sure you'll enjoy the journey now, henceforth, fighting
Naumika,
it out and
we
still
love
having
you.
fun.
We
Thank you.
love you as the chairperson of AHA. Looking forward. Salutations to you. We want to have you in our team and all the best.
Thank you. Now I call upon Venkat Kalyan to please share his youth voice on fitness. Over to you, Venkat Kalyan.
Namaste, sir. Am I audible? Hello? Hello?
Yes, yes.
Yeah. So, namaste, ma'am, and good afternoon to everyone. Dignitaries present in the meeting. So, I'm JV Kalyan, and I'm from Andhra Pradesh, final year student from KL University. So, I'm here representing Safe Life Club. So, Safe Life Club was started by KL University in collaboration with AP-AHA and UNICEF, and also RKSK. Ma'am, initially, I want to thank President of AHA Forum, AHA Youth Forum, Himabindu ma'am, and also Sarima Bhatia ma'am from UNICEF, Nirmala Glory ma'am from AP government, and representing RKSK also. So, ma'am, this Safe Life campaign majorly focuses on health of the youth, that too within higher education institutions. So, ma'am, when we started our journey, like we started questioning ourselves, what are our major problems? Then we finally realized we were unable to identify our health problems as problems. So this is our major problem. So most of us were too obese, like we were overweight. We were like figuring out what would be the reasons. The first reason was availability of proper hygienic food, which we communicated with the management of KL University, and within a span of 2 months, we made significant changes in our daily routine diet. And second thing was we were completely restricted to our classrooms, and soon after completion of the class, we were restricted to our hostels. So we started making like-minded teams so that we can work together, we can brainstorm ourselves, we can think, we can debate with each other, we can come out with something productive. Then, ma'am, we also realized one thing, that health, wealth, family, society, these four are our major priorities. So as As per working on our wealth, we are studying in one of the prestigious universities, so we can take care of it. But we need to take care of our health, then our family, then our society. Somewhere we also realized before serving the society, we need to serve our own bodies. So we started working together, we started doing yoga together. So we had a team of 60 students as a pilot run. So all the 60 students who used to go to the yoga classes regularly in the evening from 5 to 6. Then we used to retrieve, we used to sit together, we used to work together, figuring out what are the problems that our students are facing within the university, and also what are the problems faced by the unorganized youth within the rural communities of India. Then we came up with a set of questionnaire. We entered the nearby rural areas, which are in Mailavaram Mandal. We made a survey nearly in 7 villages. There we find an interesting thing, ma'am. When we were questioning those students, school students there, we made a useful insight. We were correlating the aggressive nature of a student with the disputes in their own family. So, ma'am, whenever a child experiences various disputes going on in his own family, his aggressive nature is very high. So we made a very good insight there, and we communicated this to AP-SACS as well. So we also connected ourselves to 2 to 3 houses as per our strength. We used to regularly talk to the children. We used to guide them in each and every step of their life. And few of them are now studying with free scholarship in our universities as well. So in that way, we made many initiatives in which AP-SACS helped us to implement them within the rural communities. And also, I would especially thank Srilata ma'am and also Naveen Kumar Garu for providing us such a good platform. And ma'am, I personally believe that we are all one. I believe in collective consciousness, which was, stated first by Ramana Maharshi, as per my knowledge. So I take care of myself. I think about myself, and in the same way, we all think and take care of our own selves. So we're all working on the same goal at the end of the day. So this is our collective consciousness. Why can't we work together to build our own empires together? So as per, behalf of the Safe Life team, and I would personally promise AHA Youth Forum that on every 18th of every month, we will definitely conduct some of the other campaign, especially for the students, ma'am. Like it might be BMI checks, it might be about promoting mental health, promoting yoga in order to tackle the mental health situations, etc. So thank you for the opportunity, ma'am. Jai Hind.
Yeah, thank you, Venkat. You spoke so well. And yes, youth are at the forefront, not just for the at the receiving end, but also leading it forward. Thank you. Now we move on to a very interesting youth-led panel discussion. I now invite Dr. Spruchna to please take over, introduce the panelists, and conduct the session. Dr. Spruchna and Dr. Srisalam, please.
Thank you, sir. Good afternoon, esteemed dignitaries, vibrant youth, and the renowned doctors. This is Prajana, and it's an honor for me to be the voice that represents the youth. So it is such a useful session, and thanks a lot, everyone, for making it happen. So without a further ado, let's dive into the panel discussion. I take distinct pleasure in inviting our panelists, Dr. Sushma Desai ma'am, Dr. Srisalam sir, and Dr. Sunita Manchanda ma'am.
Namaste. Dr. Sunita madam, unmute.
You have to stop sharing. I think somebody's screen is visible.
No.
Good afternoon, everyone. And Dr. Sushma Desai.
Dr. Sushma Desai just now messaged. She's in some other meeting, so she'll not be able to.
Dr. Srisalam will manage.
Okay,
Yes.
fine. No problem. Okay.
Yes, sir. So, may I ask Dr. Srishailam, sir, what are some practical and sustainable ways for youth people or for the young people to maintain a healthy weight surrounded by an unhealthy food options, and how to control that urge or resistance?
Thank you, Dr. Sprujana. It was a question pertaining to the present day situation. I understand the adolescent and the young are really under very challenging moments. It's a very tough time for the students of this time to maintain a healthy diet and healthy weight, because they are surrounded by so many easy methods of procuring food. When we were of your age, I think this was not the situation. Our hostel canteen, our hostel mess was the only source of nutrition and energy. And I am damn sure that no canteen or, for example, hotels in those days which are serving food, anybody could become obese eating those stuff, because they are already not that nutritious, rich, or with lots of fatty food. But present day situation is very easy, that
Hello.
you get your food right into your room,
ఉన్నాను
right to
కానీ
your
ఇప్పుడు
hostel.
మీటింగ్ లో బిజీ ఉన్నా
It has
1
become
hour
so
పడుతుంది
easier.
సిక్స్
So,
సిక్స్
but
సిక్స్
still
అలా
nothing
6
to lose. There are various methods by which we can still maintain. So always remember that it's a very simple one, 80-20 ratio, where we can balance our food. Suppose you are helplessly in a situation, try to maintain to have a healthy diet, at least 80%, and 20% give
అయితే యూట్యూబ్ ఛానల్ లో
laxity.
కూడా జారిపోయారేమో
So
మనుషులు
enjoy your homemade food more common. I think whole food should be encouraged. Now, simple examples, you can make some smart swaps. Small changes can this. Suppose you have no option but to eat a pizza, you can just swap it with having with a whole wheat, which is made of whole wheat, and go for less topping with highly, uh, cheese, extra cheese, and all those things. So just swapping is very important method wherein youth can do that, and avoid, like for example, French fries. You can go for roasted or sweet potatoes. If we are at home also, you can do these changes. And sometimes we get sugary drinks, so try to go for alternates, like a buttermilk, a sherbet, which can be made at home, or less sweetened drinks, or the coconut water. Of a simple example, I think water is the best drink. So I think these small changes can give a big impact. And another very important is the peer pressures that youth really face. When I was a kid, I was very smart enough to escape many of these, parties and this thing. You can avoid in various way. Some of the very easy techniques, I think, where you can avoid the peer pressure is, do not compromise. Like for example, if your friends wants to go and eat a fast food, so you try to choose a place where you get a healthy food also. Like sometimes there are places where you have a salad bowl, so choose those ones and encourage your friends, you can take them so that they can enjoy their fast food, and you have your choice also. So I think this is the method, I think, some of the way to, regarding the peer pressure and how to handle it, and majority of the time, you can even eat before going for the party. That's very important and easy method, I think, so that you don't feel hungry and you don't tend to eat more at the hotel or the party. So these are some practical things, I think, which we can do to sustain. And another thing is that try to delete many of these apps from your mobile phones. All these, there are many online apps which can deliver the foods. So I think one of the important thing is delete them. One of the easiest method, I think, which I none of the online delivery apps I have in my mobile phone. So thing can be done, I think. So, and avoid emotional eating also. Sometimes some of the youth tend to go for eating more during stressful times. So I think these things can be done to sustain. So, and always follow healthy social medias also. Sometimes they focus so many things that can be done, having these protein shakes which will improve your health and all that. So I think we should not fall prey to them. choose wisely.
Yes, sir, definitely. I think we should all consider those inputs to build that resistance. On that note, I'd like to ask how young people can overcome the stigma and body shaming associated with obesity and instead focus on programming self-body esteem, positive body image.
Yeah, and body shaming is truly a very serious issue. And it is serious because it affects the mental and emotional well-being of that individual. So, and we should understand that every individual deserves respect and dignity, regardless of his body size. So, and even the societal standards of beauty are very unrealistic, and often they are very harmful. And they are many of the times they are the ones that leading to the low self-esteem and lots of mental health struggles. So one has to realize that health is not about being of a certain size, which is shown on the meter or something. It's about feeling how strong we are, how energetic we are, and how confident we are. So let us redefine what is beauty, and we should include that self-care and self-love is also part of that. So, and one should also learn to self-acceptance and the body positivity. So teach the how to do the self-love and self-compassion as an alternative instead of self-criticism. So, and we should encourage the youth to celebrate their unique features, and appreciate their bodily, what they can do, rather than how it looks. So these things really, they're very simple, but they matter a lot. Now, not everybody will understand your journey, but what matters to you, and see yourself, and also embrace the warmth and beyond the appearance. So these are very important. And learn to respond to body shaming comments with confidence. Recently, we have seen even a great sportsman like Rohit Sharma, he was not spared. And this body shaming does not happen in schools and colleges only. It happens in intellectuals and in the sphere where we see this. And very rightly and encourage you should, it is a shift in the mindset from looks to health is also very important. So one has to focus not on the weight or appearance, but they should focus on their health, strength, and well-being. So I think Rohit has well proved by his performance. So what not everybody might, but that confident enough to do that. So healthy habits should come not from self-care and not from the guilt. So one should start learning to have a healthy life, not just because he's been insulted, has been mocked. So it should come as a habit from the self-love. So one has to remember that it is very, if I ask somebody, what is easier? Is it doing the body shaming or avoiding it? I think it's very easy to avoid body shaming, because these are the ones who, instead of training a obese individual how to toughen up, how to face the challenge, the society should stop the shaming altogether. The schools, the families, and the social spaces must actively discourage body shaming. I think in this way, the youth can really escape.
Yes, sir. Now we understand how important it is to be confident in ourselves. And now I request Dr. Sunita ma'am to answer on what role can social media play in promoting healthy lifestyles and combating obesity among young people. Influencers for making a positive impact.
Right. Hello, everyone. Am I audible?
Yes.
Okay. So what I can say, first of all, I would like to thank Sprojana for asking me this question. And second, I thanks the IAHA for having you guys at this panel. So very nice to see the youth. So I would like to give a very short and quick message. It is the social media, what it is. It is just a medium. Who is the force, or who is the reason, or who has to be good enough is the people around. And out of the people, I choose the youth people, because you are the one who is a, nowadays is a very powerful source of all the information. So important is, first of all, that youth has to come forward and use this your social media judiciously. What does that judicial use of social media? Because so much of information. So I would say the term media literacy. At individual level, I would say be a media literate person. How you can be media literate? So much of information, joining the right, groups, as has already been done on this platform today, that you get the right information, so that you can use the right, you can gain, first of all, the right information from the right sources and having a reliable source. Number two, there are so much or so, information, अच्छे से ज्यादा बुरा वाला लगता है. राकेश रोशन है या सलमान खान, they are talking about coke. What we can do? Either we can be silent, or we can, this is very difficult for, to oppose these people. But at least if we want to be silent of the wrong information, it is okay. That is saves our energy. But if there is some good information, please spread. For example, if I would say influencer, I think people might have seen that some video on the social media of a football player, Ronaldo. Has anyone seen? It was about that in the good Euro 20 conference, press conference, he removed that 2 Coke bottles and bring the water in front of everyone. So what does that message? Coca-Cola company to gayi, uska bahut loss hua. But he was the person who could, take this stand. So these kind of messages forward to individual capacity mein aap kar sakte hain. So that is a good, and of course, learn from them. Third important thing, I would say, recently be an entrepreneur. If you don't get the right, social media program, try to engage with your group and with all of the people who are the youth, today, I can say all the so much leaders I can see. So they can come up with program. For example, I have seen, I was a person who does not like to go for online things. And online yoga was a so-called no for me. But recently I have, joined that Ha Build. I'm not a advertising person for that, but I'm just giving you an example. This program is a very good. It is paid by Mr. Saurabh. He started in during the, if a few of people, he started during COVID time as a kind of, apna time pass karne ke liye with few people, 5-10. And now he had made this a community benefit program. It is a very good program. I'm talking about in terms of social media. It is not like he'll send messages to all, even if we don't attend it, thank you, you attended. No, it is an individualized, customized program. Secondly, he sends every time a motivation message, and his way of, giving the message to do yoga is definitely going to encourage youth girls. So message is very clear. Be a media literate person. Number two, be an entrepreneur. If you can, it is good. If no, you're not, be an individual, responsible person. Spread the right information, and you have a right to choose whether or not to discourage or be silent if the information is wrong. I think, I hope this probably is my way on this, but rest of the people can add on it after this panel is over. Right.
Thank you, ma'am, and we'll make sure we put our perspectives in choosing what is right for us. And how can young people advocate for policy changes and environmental supports that promote healthy eating and physical activity in schools and communities?
Right. So I'm sure all of people, young people, and being you guys as an advocate, you are very much aware of your strength. But only thing is the channelization, which is needed. How to be a channelized? Either work at an individual level or work at a leadership group level. Individual level actually somehow is, limited role and needs quite a lots of effort. And especially, I think I appreciate Nomika's efforts. I was really, it was an inspiring story to know how she faced the challenges. But the best part is, and she is also, example is in front of you. She is being now, not only overcome her challenges, but also become an advocate for the youth health. So number one is that. Second is, I would say today's every colleges, so I know there are various clubs and, so I would say come forward for these youth groups or youth good groups, leadership groups, not like, of course, entertainment groups have a different role, but also the leadership role has to be in these groups. And if these groups are well maintained, then I would say even the people, your teachers, even your parents, and even Modi ji also has said that youth power, they will listen to you. But you have to come up with the right choices with a elegancy and grace. In that case, like, how can you do? School teachers के साथ आप बात कर सकते हो for having a good physical activity, physical activity playgrounds, first of all, and rules. When we were kids, we used to have in the morning assembly in the playground. Nowadays, we see what is happening. It is happening in the schools. So, but if we say as a parent, as a teacher, probably it will not be heard that much. But if youth forward, you guys, instead of, I mean, the youth I'm talking about, come out of your mobile thing and then come in front that we want to have assembly at the playground. These are very small, small steps which you can take, but individual level, it is difficult as a group. Then, of course, advocacy at the government level, of course, Dr. Rosa has told, and you can, this can be carried forward with the various organizations, like, for example, AHA. I am grateful Dr. Hima Bindu has come up forward with this concept of youth, and it is really nice to see that. So that can be done. Third is be a role, make things good programs. For example, now 100 Days Challenge has been, made under guidance of Dr. Sri Silam. These are the kind of programs and the quiz which has been made by myself, Dr. Amog, and Dr. Sameer. So these kind of programs with a fun kind of activities, so individual level, group level, and the organization level, which everything has been done here in practical and live experience. And I think from this kind of experience, and I hope you can spread this message and all the preparation and the right information material to forward. And last but not the least, if you get successful in that, you can have in your community place, for example, tie up with good organic farms, like, so that they can supply good thing, good gym people, not like the one who gives you protein shake and all this. No. So you can be, take actively part at community level in being having these right things at your place and then spread the message. So I hope if सोच लिया जाएगा तो हो जाएगा काम. So this way you can do that.
That gave us a lot of insights, ma'am. Thank you so much. And now I'd like to put forward one final question to Dr. Sri Shailam, sir. What are some common myths or misconceptions about obesity that young people should be aware of? And how can they separate the fact from fiction when it comes to healthy weight management?
Very nice question. And I think there are lots of myths. Yeah. Myths about obesity, I think majority of the time, many of us are judgmental. So many of us, there's a myth that obesity is seen in those who have very, very poor willpower. They think that they do not have a control of their eating. And the fact that weight gain is not always due to lack of the self-control. One has to remember there are other factors, the biological and the physiological. For example, you have the hormonal disbalance, the genetics, the mental health, the environmental factor, and the lifestyle factors. So it is not just about the willpower. So this very important one, which the myth there has to be cleared. And there's another popular myth is that those who are thin and lean, they are healthy, and those who are obese or overweight are unhealthy. And they're underperformers, majority of them. But we have many examples, we can see from the choreographer Saroj Khan, with her heavy weight, still she performs, she dances. And like that, there are so many examples. And as in the previous one, I said, Rohit Sharma was being, body shaming like Motu, but he still runs so fast and he plays so well. So I think that type of myth should not be given stressed about. And one more thing is that if you want to lose weight, you have to starve. So this myth is there. But the fact is that healthy weight management is not about abandoning the food or avoiding the food. It is only about the healthy eating, the mindful eating. So these are the ones which everybody has to know that. And some of them think that exercise only can solve obesity. That's a myth everybody think, but it's a holistic approach, a combination of healthy eating, physical activity, stress management, and also sleep. Sleep also is very important in the management of the obesity. So, and like those things, some of them have the myth, that drinking lemon tea or some detox is a good weight management and the only method. So, but we have to remember that they could contribute to the management of weight management, but they are all hydrating liquids. So some of them, they get carried off with Instagram, many of the posts being done through the reels and everything. So I think they should remember, they should trust not the trends, but the science. So they should be very able to choose what is best for them and not just follow blindly. And there are myths that carbs make you fat. So carb has become almost like a poisonous food item, for majority of them. So don't look carbs, but you should look that what are the healthy carbs. That is to be remembered. So carbs are the part of the macronutrients that body needs. Nothing in the nature is made so poisonous. So let us not look at food as a poison, but as a thing that can provide us nutritious and nutrition and energy. So such myths have to be cleared for majority of the time. And even few of them think that अगर तू obese है गया तेरा जिंदगी तो गया. They think that it's a life sentence and you can't change it. So I think those things, but the truth is not that. Weight management can make them healthier. Physical activities can make them healthy. So it is not a life sentence. So I think these myths to be cleared and the facts have to be told. And majority of the Instagrams and social media, it's very tough because everybody is in reach of this. And there are so many diet plans, the intermittent fasting, regarding the detox, starving diet, fasting mimicking diet. So I think those things really harm more. It is not what suits to your body. You should choose and wisely. And the people who give a correct information are the doctors, the dietitians, the physical trainers, of course, qualified ones. So I think you should choose them rather than following the trends which are there in the social media.
Yes, sir. I think the instances you put forward burst really a lot of myths, which are very commonly believed by people all over, I guess. And I think it would be a tough pill to swallow regarding these myths because all of them are like whatever is assumed to be true or not true. So I think people gain a lot of knowledge on this aspect. And thank you so much, sir.
And also, I would like to say one more thing along with all that what we are having. It's very important that life skills education, meditation, and yoga, and a bit of spirituality involvement at the youth level will help you to take a good life, not only to face the challenges with obesity, but overall health in the life also. So I think that's done from my side. Thank you.
Okay. Dr. RSV?
Yes, Master Ashwin.
I
Thank
think
you
we
so
should
much.
go for the launch of the 100-day challenge.
Great job,
Is there?
Sprujana. Sprujana leading the thing was such a wonderful job. She's only a second year student in MBBS and she's done excellent, Sprujana. My personal appreciations to you.
Right,
and of course, Naumika Khanna was
Thank you so much.
mind blowing, and they appreciate all the youth voices. Yeah. Yeah, your launch, Srisalam.
Okay.
She
Good
should have
evening,
plan
everybody.
B. Plan B.
Okay. Okay, sir. Okay. Good evening, everyone, and welcome to the launch of the 100-day challenge by the IAP-AHA Youth Forum, the Wave 18. I am Dr. Kotturu Srishalam, the program in charge from Telangana, and I'm thrilled to introduce this exciting initiative. Now, the title is Way for Wellness and Fitness. Now, what is the main objective? Now, the main objective is to encourage consistency and to build. And what I wanted to do is habit forming, because we have to foster this habit forming. So, this simple yet very impactful goal of 10,000 steps per day is the challenge which we planned for the 100 days. And this challenge is not limited only to the youth. We invite everyone to join us and become the ambassadors for the wave for wellness and fitness. And as the saying goes, young learn from their elders. So let us set an example and inspire the next generation to prioritize that health and well-being are important. Over the next 100 days, we will provide you all the motivation and support. So I request everyone, believe that small, consistent changes, they can lead to a significant long-term benefit. So I hope everybody is ready to take up the first step tomorrow. The program is going to be launched on 24th of March until the first July 1st. So it will be the 100 days. So we'll be sharing the link in various groups. I request everybody to join. So from 24th March, 12 a.m., this challenge will start. So I request everybody to join and be part of this wave of wellness and fitness that spreads very, very far and wide. Thank you. So the QR code is there and it will be shared in the various groups. And on 1st March, on 1st July, Doctors' Day, we'll be declaring the first winners and runners. So the 10 participants, Dr. Himabindu Madam and Dr. Arya Sir were very generous. They have said that we'll provide the t-shirts and the medallion for the winners
Yes, we
and the
promise.
participants. Okay, fine. Thank you, madam. So I request everyone to please share this QR code and let us have a healthy nation. So, Apun fit to Desh fit.
So after that of the 100 days challenge, now we have to launch one more thing, that is about the quiz for the youth. And this is the youth, yeah, it is a youth wellness and fitness quiz. This is a first quiz of the series. It is prepared by the Dr. Sunita Manchada and Dr. Amok. And the participants of the quiz, these are the few instructions that they have to follow for the getting the certificate also, and the winners and runners up certificate and participation in the last mega quiz at the during Adolescent at the Ahmedabad. The age of the participation of the quiz between 13 to 21 years. Quiz will remain from now onward next 7 days. 75% marks is the minimum required to get the participation certificate. That is very important, and only single attempt will be allowed. Winner and runners-up will be announced in the next month of the next 18 on the basis of the highest mark and how early they attempted the quiz. The only first attempt will be considered for the winners and runners-up. No other attempt will be allowed. For 6 consistent participants, because this is a series of the quiz started from this month up to the end of the August, and all the consistent participants who is continuously participating in the sequence of the quiz, total cumulative mark will be considered as the highest mark, and the 6 participants of them will be get the chance to participate in the mega quiz during the Adolescent at the Ahmedabad in September 2025 between 19 to 21. So this quiz is also now open, and I already circulated the link and the also circulating the logo of this quiz that will be circulated through you to the different part of the country, and anybody can participate between the age of 13 to 21 for this quiz. Thanks a lot for giving the and let's try hard to get the chance in the mega quiz. Thank you. Over to you, Himavir ma'am. Yes, madam.
We appreciate the efforts of Sunita for this quiz. Thank you, Dr. Even Samir, for holding this. I hope this will be widely circulated and many youth will participate. Yeah. So we have, I think, we have finished the launch of the survey, Dr. Sunita. We would like to survey on fitness.
Right. I can just tell that. So as we have seen that youth are actively participating in taking programs ahead, but at the same time, you need, a kind of a right force behind you also. Here we are, medical professionals, we are always there to help you, but at the same time, we also want to improve, or we know how we can be, a guide to yourself. So with keeping that in mind, we have prepared this survey myself and also guided by Dr. Sameer Shah. So this survey is basically aimed towards medical practitioners. And what I want from this survey is 3 points, the basis behind it. Number one is we can get a basic insights about knowledge, attitude, and practices of the pediatricians and other medical professionals regarding physical activity, like what they know about it and what they can, are they guiding their youngsters or their patients or not? That is to getting that the information so that we can identify what are the gaps or what are the challenges they are facing, and we as a team organization like AHA and other organizations, IAPs, can help them to fill up this gap, whatever gaps we identify. And third important thing is because we are still lacking in community community, information data. Whenever we want some kind of a advocacy or we have to program a plan related to youths, we really need to, show them that look, this is the thing. So I have made this survey keeping in mind that it might form a basis for the research later on once we get the information, and then we can present or may not. Well, time will tell us. It may help in implementation. It may be an add-on to the things which can help us to program, implement, or make programs as per needs identified from there. So again, I can say in nutshell, it's a effort to make efforts towards wellness and fitness of the youth, of the young generation, involving media professional as a right person for them. Thank you.
So Sunita is from Gurugram. She is a senior consultant pediatrician and adolescent expert. And she has taken all the efforts to bring this, we want the facts, in spite of so much knowledge around, still many of our pediatricians also struggle to be fit due to their lifestyle or time. So we want to understand what are the challenges, what they're facing, what Dr. Sunita says. I hope you'll be sharing the link, Sunita, to get this survey done fast.
Right,
yeah.
right. So it is for the medical professionals.
Yes,
Dr. Sameer?
Just giving the input on regarding that. This survey is already available on our AHA website also, and we will circulating this link for this survey also. And this survey will remain open till the next 21 days. After that, we will come with the result at the next 18th about what this survey comes out. So that's this survey will be open for the next 21 days. Thank you.
Yeah,
and it is for every professional. It is for not only for pediatrician, for everyone.
Thank you. Dr. Sameer, I want to request you to kindly, this is a vaccination month also, and we have the AHA has actually developed consensus guidelines on adolescent vaccination, especially on HPV. So I request you to kindly upload on our AHA website. It has been circulated in our EB. So we can, any revisions are there, we can again re-upload. On this day, we announce that we are uploading the consensus guidelines on HPV vaccination on behalf of Central AHA. So this will be available on our website of AHA. So I request Sameer, who is our digital lead, to do the needful. Thank you. And now Dr. Richa is, I think, there. She has developed a good poem and a song. It is huge file. I request her if she can, this is the white paper developed by the Adolescent Health Academy on optimizing HPV vaccination in adolescents. What are the consensus on how to close the gaps, practice gaps for enhanced impact? So you can, this paper is uploaded today on the website of AHA. Dr. Isha, are you ready with the, this is the last item on the day today? Are you ready with that song?
Yes,
Can you?
yes. I just want to say a few words.
Yeah,
I
yeah,
first
please.
of all want to congratulate on the behalf of IAP West Delhi.
She's from Delhi. She's our president-elect of the IAP West Delhi, and she's been secretary of West Delhi in 2022. Very active youngster pediatrician from Delhi. Over to you, Richa.
I just want to congratulate the entire team of IAP-AHA, especially Dr. Hima Bindu ma'am, Dr. Sri Selam sir, Dr. Sunita Manchanda, Dr. Samir Shah, everybody for a wonderful launch of this Wave 18 for Wellness and Fitness. And I want to say that a happy soul lives in a healthy body. So my request to all the youth here to have a healthy body so that a happy soul can live. And I just decided whenever were having the last meeting, I thought that what I can do. So I did a small youth survey of young people ranging from 16 to 24 years of age, college going, regarding what is their knowledge on the obesity, non-communicable disease, what is their life pattern. And I am fortunate that there was the background song of this video. Actually, it has been created by none other than Dr. Smita Mishra, who is the president of IAP West Delhi. So I'm just going to share the launch and the video as well, the compilation. It's a very big file, but we'll be sharing a small part of it. So I hope you will just enjoy it.
I think we all can dance with this video also. Physical activity will be there.
While this is being played, I really want to congratulate and thank everybody, those who have joined today. It was a very successful Youth Wellness Day. All the launches today of the different challenges and different quiz and other activities, I hope the youth will take it up and will sum all these activities together and have a good report. And we'll just want to see the triple effect. Yeah.
Health is wealth. Health is
I really
wealth.
like this song.
Swast healthy whole India. IAP is for healthy nation. IAP is for healthy children.
70th percentile circumference of waist. Cardio-metabolic threat. Metabolic syndrome, diabetes, hypertension.
So think of mindful eating. No food fad, no binge eating. Children, you have to eat fresh food, vegetables. Check labels on pack. Must be available. Eat only when only you hungry. No food addiction to land into obesity.
Overweight children. Never forget to run, jump, have dancing feet. Never sit for very long on your seat. Fresh air and happy day. Early to bed and rise early. Every day run, skipping the rope. Give salute to sun, Surya Namaskar every day. Springdale parrots and little birdie. All wake up early to be fit physically. See dogs how they stretch. Then why we be lazy on bed? Boys and girls both study a lot and find time to play a lot. Never forget to work in kitchen and give your mom some relaxation. 5 fruits and rainbow meals.
Stay away from refined flour.
White rice, excess salt and sugar.
Have students squat and watch if drugs are chosen a lot. Be happy and share happiness. Tick-a-tick-tock-ta-da-da-dum. Make school bag lighter, less than 1/10 of weight of child.
Be a child-friendly guide.
School bag has to lighter. Students squat to check on campus practice. Hey. Health is wealth. Health is wealth. Swashed healthy whole India. IAP is for healthy children. Health is wealth. Health is wealth. Swashed healthy whole India. IAP is for healthy nation. for healthy children.
That was so good, very rhythmic, very trendy.
Very
I hope
nice.
all the youth will enjoy. Really thank Richa and Smita Mishra to give us this song. Thank you so much.
Thank you,
And
madam.
it was a
Just one
very
or
good
two
edit.
answers.
Obesity
And
like
also-
जो भी ऐसे मोटे लोग हैं उनको होती है.
Obesity is basically overweight people who catch up certain diseases, and obese people suffer from various other problems as well, hypertension, cholesterol, etc., etc.
Yes, ma'am. According to the BMI, if you range over 18.5 or 19, you came under the category of overweight or obesity.
क्या हमारा BMI अगर 18 to 24 है तो उसके बीच में मैम हमारा इतना होना चाहिए. अगर उससे ऊपर अगर हमारा है तो मैम हम लोग ओवरवेट है, और ओबेसिटी का क्राइटेरिया 50.
कितना
50 मैम.
नहीं, ये आपको थोड़ा रीचेक करना.
Point we become overweight or underweight.
It's a body mass index. We calculate, we divide the body
Madam,
weight
meeting will
kg,
conclude in next 3 minutes. Huh?
Yeah. You can,
Our Zoom.
Dr. Isha,
Yes, sir.
we
Yes,
should be
sir.
able to wind
Yeah.
up now. It's 5:45.
Yes, ma'am. Yes, ma'am. Thank you so much.
मैं पहले जिमिंग करता था, फिर बीच में जिमिंग छूट
So,
गई.
thank
मेरा-
you so much, and vote of thanks by our Dr. Arya or Dr. Shamik Ghosh and Dr. Sameer. Any one of you, Dr. C. Salem, the program in charges. On behalf of me, I really would thank so many of you who have joined, especially the UNICEF representative, Dr. Ali, Dr. Salima, all the youngsters, and Dr. Zoya, Madam, and Central IP leadership. The formal vote of thanks, Dr. Sameer and Dr. C. Salem, over to you.
Okay. So it's really a great pleasure that on the every 18th of the every month what we are doing and conducting such an activity that really motivating not only the youth but the inner youth of the ourselves also. So for that purpose, I sincerely thank the each and every youth participants along with the all the participants of this initiative that include the UNICEF, AHA, IAP, and all the other concerned relative agencies who are really taking a great initiative to give us such a boost to enthusiastically improve the health of the adolescent, and that will give us the triple benefit of the to our nation. And for that purpose, my sincere thanks to each and every today's participants, today's faculty, and the youth who has really involved and given their inputs regarding how the other people can also follow them. Such like the Naumika given such a excellent experience about the diabetes, and that will motivate so many people definitely. And for that purpose, I sincerely thank each and everyone, and let's continue our work to motivating each other and each one ourselves also for such type of the activity. Thanks a lot once on behalf of the IAP-AHA. Thank you.
Thank you. Salima, can we call it a day?
Yes.
Yes, ma'am, and a big thank you to everyone. The whole team has worked so hard. Amazing. Hats off to IAP-AHA. Thank
We had
you.
many sessions today. I think we should limit and make it more entertaining. So next time we'll take care, and we'll do it
And
within 1.5 hours, and we'll
before we
have youth
conclude,
influence.
before we conclude, madam, I just wanted to tell, I should appreciate your energy, madam.
Yeah, that I agree.
No.
Dr. Salima and Dr. Hema Bindu's energy. Yes.
Whatever things we have done today, they were there for a very long time. But it is your motivation that has led to the things to come true. So I think let us continue the challenge. Everybody participate, and I thank RSV for nicely conducting the session.
Special thanks.
Master of the ceremony, and Dr. Salima, thank you very much. And we should thank them from the ministry, Dr. Zoya and Dr. Ali from UNICEF.
So
And,
nice of
Nirmala.
Dr. Salima to get them on board. And also, I really thank all of you, C. Salem and Sri Krishna. You're all my buddies. And I'm here because of all of you. And definitely we have a lot of dreams to do, but we can do it collectively. Definitely we can do it. And Samir Shah, everybody is doing that extra mile. You know, we're all doing a routine work and doing all of this just for the passion to work for youth. And we are all here on board. So really, we
And,
salute the young people who have joined us. Look forward, all the
Dr.
activities have been
Dr.
initiated.
Neha was also assisting for the
Yes.
slide preparation.
Yes,
And
Dr. Neha, flyer. Everybody has done so much. Yes.
Yeah, Sachetan was also there. I think today I didn't because he's
It
having
was a
college.
pure teamwork, and you had led the team, Dr. Sri Salam and Samir, very effectively. Thank you so much from my side too. And looking
Thank you,
forward,
ma'am.
all these initiatives which are launched today, we have to follow it up. Don't forget to pursue all these activities so that we get a good outcome. Thank you.
Okay,
Thank you, Naumika. You're so
Okay.
sweet. Thank you. Naumika, we want you on board. Thank you. And all of
Thank
you
you.
today.
Thank you,
Dr.
ma'am.
Nagendra also. Yeah. Thank you. Bye-bye.
Okay, ma'am.
Thank
Bye.
Dr. Ali. Is there? Dr. Ali is here. On
I
behalf
think
of
Dr. even though I think
Yeah.
he's left. Yeah.
Right. Please accept.
Dr. Rajiv was here. I wanted to say thanks to
Yeah,
him
Dr.
also,
Rajiv.
but I think he's also left. But yeah, thank you. Thank you, everyone.